The voice cut across the emergency room like a scalpel. "You, janitor, get out of my way." Dr. Townsend didn't even look at the old man in the faded work uniform as he shoved past. The janitor's mop clattered against the wall. His hands, weathered and scarred, steadied the bucket with movements too precise for someone just cleaning floors. What Dr. Townsend didn't know was that those hands had performed over 300 field surgeries in conditions he couldn't imagine. And in exactly 8 minutes, when the teenager on table 3 stopped breathing, those hands would be the only thing standing between the boy and death. Vincent Chun caught the mop handle before it fell completely. His fingers wrapped around the wood with unconscious precision, the same way they had once gripped surgical instruments in places that didn't exist on any map. He was 67 years old. He wore donated work pants held up with a belt 3 sizes too large and a cardigan that smelled faintly of mothballs and industrial cleaner. To everyone rushing past him in the chaos of Metropolitan General's emergency department, he was invisible. Just the old man who mopped up blood and emptied trash bins and kept his head down. Dr. Blake Townsend was already shouting orders at the nurses clustered around Trauma Bay 2. The chief of emergency medicine moved with theatrical efficiency, his voice carrying across the entire department. "I need a chest X-ray stat. Someone page cardiothoracic. And for God's sake, can we get maintenance out of the clinical areas before they contaminate something?" Vincent stepped back against the wall, pulling his cleaning cart with him. He had learned in 18 months of working here that the best strategy was to become part of the furniture. Invisible, forgettable, safe in his anonymity. He watched Dr. Townsend's white coat disappear into the trauma bay and returned to mopping the floor outside the supply room, where an earlier patient had bled through his bandages. The emergency department at Metropolitan General operated at a constant simmer of controlled chaos, but today felt different. Vincent could sense it in the quickened pace of the nurses, the tension in their voices over the radio. The overhead speakers crackled with static before the announcement came. Mass casualty alert. Multi-véhicule accident en Interstate 405. ETA 6 minutes. All available personnel to emergency receiving. The words hit Vincent like a physical blow. His hands tightened on the mop handle. For just a moment, muscle memory transformed his posture. His shoulders straightened. His eyes tracked the movement of personnel with tactical assessment. Then he caught himself, forced his spine to curve again, his shoulders to slump. Just the janitor. Just the old man who cleaned up other people's messes. Nurse Ramirez rushed past, pushing a crash cart. Her dark hair pulled back in a tight bun. She was one of the few who ever acknowledged him, who said good morning or asked how he was doing. Now her face was set in concentration as she prepared for the incoming wounded. Vincent watched her check the defibrillator, verify the medications, her movement efficient, but not quite as systematic as they should be. He wanted to tell her to reorganize the airway supplies, that she would waste precious seconds reaching for the laryngoscope blade if someone coded. But janitors didn't give medical advice. The first ambulance siren wailed in the distance, growing louder. Vincent moved his cart toward the far wall, out of the way of the incoming chaos. He had positioned himself near Trauma Bay 3, where he could see through the glass partition but remain unnoticed. It was a habit he had developed without conscious thought. Always maintain visual contact with the wounded. Always be ready to move if needed. Old instincts that wouldn't die no matter how many floors he mopped. The automatic doors burst open and the first stretcher rolled in, surrounded by paramedics and a cloud of diesel exhaust and urgency. Male patient, approximately 45, restrained driver, significant chest trauma, possible pneumothorax. The words washed over Vincent, and his brain automatically processed them, cataloged them, began formulating treatment protocols before he remembered that it wasn't his job anymore. Hadn't been his job for a very long time. Dr. Townsend took charge of Trauma Bay 1 with his characteristic loud confidence. "Someone give me an ultrasound. I want a fast exam before he even hits the table. Let's show these people how a real emergency department operates." Vincent could hear the smugness in the doctor's voice, the performance of competence for the benefit of the medical students clustered in the corner taking notes. More stretchers arrived. A woman in her 30s with a steering wheel imprint across her chest. Two children from the back seat, both conscious but terrified. An elderly man complaining of neck pain. And then the teenager, pale and quiet on the gurney, eyes wide with shock. The paramedic's report was grim. Jason Miller, 16 years old, passenger side impact, significant abdominal trauma, blood pressure dropping despite 2 liters of fluid. They wheeled Jason into Trauma Bay 3, right in front of where Vincent stood with his mop. He pressed himself against the wall as the trauma team swarmed around the boy. Through the glass, he could see everything. The resident cutting away the teenager's shirt, the bruising across his abdomen. The way Jason's breathing had become shallow and rapid. Vincent's hands moved unconsciously, fingers tracing the steps of an abdominal assessment in the air. Inspection, palpation, percussion, auscultation. The 4-step dance he had performed hundreds of times in tents and bunkers and the backs of helicopters. Nurse Ramirez was in Trauma 3, starting another 4-line. Her hands were steady, but Vincent could see the concern in her eyes as she watched the monitor. The boy's oxygen saturation was dropping, his heart rate climbing. Classic signs of shock, but from what source? Internal bleeding was the obvious answer, but where and how much? Vincent forced himself to look away, to push his mop across the floor in slow, methodical strokes. This wasn't his world anymore. He had given up the right to be part of this dance when he had walked away from medicine, when he had decided he didn't deserve to hold a scalpel ever again. The mop handle was smoother than a surgical instrument, required no precision, demanded no life-or-death decisions. It was safe. It was penance. But his eyes betrayed him, drifting back to Trauma Bay 3. Back to the teenager whose color was getting worse. Back to the monitors that were telling a story the trauma team hadn't quite read yet. Vincent could see it forming, the pattern emerging from the vital signs like a picture developing in a darkroom. Something was very wrong with Jason Miller, something beyond the obvious trauma. And in a few more minutes, that something was going to kill him if someone didn't figure it out. Dr. Townsend swept past Vincent's position, barely sparing him a glance. The chief's attention was split between 3 trauma bays, his commanding voice directing residents and nurses with the confidence of someone who had never doubted his own expertise. Move, people. We got 6 more coming in. I need labs on all criticals. Someone tell thee, or we're going to need at least 2 rooms ready. Vincent's sleeve had ridden up slightly, revealing the edge of a tattoo on his forearm. He pulled the fabric down quickly, covering the faded ink. Coordinates. A date. Initials that belonged to someone who had died while he held her hand and whispered promises he would never keep. The tattoo was a map of failure, a permanent reminder of the day everything had ended. If you're watching this story from anywhere in the world, we'd love to know where you're joining us from. Drop a comment below telling us your city or country. And if stories about courage, sacrifice, and second chances speak to you, please consider subscribing to our channel. Your support helps us share more incredible true stories that honor the forgotten heroes among us. Now let's continue. The trauma bay was getting louder. More voices. More urgency. Vincent could hear fragments of conversation through the glass. His pressure's still dropping. Push another liter. We need to get him to CT. But the CT scanner was backed up with patients from the accident, and Jason Miller's vital signs suggested he didn't have time to wait. Vincent's hand found the scar on his forearm through the fabric of his cardigan, the ridge of tissue that marked where shrapnel had torn through his arm during a mortar attack in Kandahar. He traced it without thinking, the way he had traced it 1,000 times before when the memories pressed too close. His fingers remembered the feeling of blood, the slickness of it, the way it cooled as life drained away. They remembered holding surgical instruments with absolute certainty. They remembered saving lives and losing them, and the impossible weight of being the last hope in a world of sand and fire and dying. Through the glass, Jason Miller's mother appeared at the entrance to Trauma Bay 3. A nurse intercepted her, speaking in low, urgent tones, but her eyes found her son on the table and her face crumpled. Vincent looked away. He couldn't watch that. Couldn't bear witness to that particular flavor of fear and helplessness. He had seen it too many times before in too many languages, in too many places that haunted his sleep. He pushed his mop toward the hallway, putting distance between himself and the trauma bays. His shift ended in 2 hours. He would finish cleaning the north corridor, empty the biohazard containers, restock the supply rooms. Then he would go back to his efficiency apartment 3 blocks from the hospital and heat up whatever was on sale at the corner market. He would sit in the dark and listen to the sirens and tell himself that he had made the right choice by walking away from medicine. That some failures were too large to come back from. That Sarah Martinez would understand why he mopped floors instead of saving lives. But even as he told himself these familiar lies, his eyes tracked back to Trauma Bay 3. Back to the teenager whose breathing had become more labored. Back to the monitors whose alarms were starting to sound with increasing urgency. And somewhere deep in Vincent Chen's chest, in a place he thought he had buried years ago, something old and stubborn stirred. Something that remembered what it meant to be Lifeline. Something that wasn't quite ready to let another person die when he knew exactly how to save them. The smell of diesel exhaust and antiseptic triggered something in Vincent's memory that he couldn't suppress. For a moment, he wasn't standing in Metropolitan General's hallway. He was 23 years old again, standing in the recruiting office in San Jose with a biology degree he didn't know what to do with and a burning need to do something that mattered. The towers had fallen 2 years earlier, and the war was calling for people who wanted to save lives instead of take them. The recruiter had looked at his transcripts and said, "You ever think about becoming a medic? We need people who can think under pressure. People who don't quit when things get hard." Vincent had signed the papers that same day. He remembered his mother crying, his father silent and proud, both of them understanding that their son was walking toward something that would change him forever. Basic training had been easy. The physical demands, the mental pressure, the constant evaluation, all of it had felt like preparation for something important. When they offered him a slot in the Special Forces medic pipeline, he had taken it without hesitation. The training was brutal. 18 months of advanced emergency medicine compressed into a crucible that broke half the candidates. Vincent had thrived. His instructors noticed the way his hands never shook, the way he could perform procedures while people were screaming in his ear, the way he treated every training mannequin like a real person whose life depended on his precision. By the time he deployed to Afghanistan in 2006, he was carrying more medical knowledge than most civilian paramedics and enough practical surgical skill to handle trauma that would overwhelm an unprepared physician. His call sign came during his second deployment. A patrol had hit an IED 20 kilometers from the nearest base. 3 soldiers critical, medevac 20 minutes out. Vincent had kept all 3 alive using nothing but his aid bag and sheer determination. When the helicopter finally arrived, the pilot had looked at the scene and said, "How are they all still breathing?" The squad leader's response became legend. Because Lifeline doesn't let go. Once he's got you, you're living whether you want or not. Vincent blinked and the memory dissolved. He was back in the hallway, his mop leaving streaks on linoleum that didn't need cleaning. His hands were shaking slightly. He gripped the mop handle tighter and forced his breathing to steady. The past was supposed to stay buried. That was the whole point of becoming invisible. But the memories had been stirred up and they wouldn't settle. He thought about Dr. Sarah Martinez, the trauma surgeon who had changed everything. She had arrived at Forward Operating Base Lightning in Kandahar Province in 2008, a civilian volunteer attached to a forward surgical team. Most doctors who volunteered for combat zones stayed at the big bases with proper operating rooms and support staff. Sarah had requested the most remote positions, the places where wounded soldiers had the least chance of survival. She wanted to be where she was needed most. Vincent had been assigned as her primary surgical assistant. She was 42 years old with silver threading through her dark hair and hands that moved with absolute certainty. Within a week of working together, they had developed an almost telepathic coordination. She would extend her hand, and Vincent would place the exact instrument she needed without her having to ask. When mortar attacks interrupted surgery, they would cover the patient and keep working while the base shook around them. She taught him advanced techniques that weren't in any field manual, tricks she had learned from decades of trauma surgery in civilian emergency rooms. They saved people together who should have died. A 19-year-old with his intestines shredded by shrapnel. A platoon sergeant who had lost 3 liters of blood before they even got him on the table. A local Afghan girl caught in crossfire whose family brought her to the base because she was the only hope they had left. Sarah and Vincent worked for 14 hours straight on that girl, refusing to give up, finding solutions to problems that had no textbook answers. When she finally stabilized, Sarah had looked at Vincent with exhaustion and satisfaction in her eyes and said, "This is why we're here. This is what matters." For 3 years they worked together. 3 years of impossible surgeries in conditions that would have been malpractice in any civilian hospital. 3 years of saving lives that everyone else had written off. Vincent learned more from Sarah than he had learned in all his formal training combined. She taught him to trust his instincts, to improvise when equipment failed, to never give up on a patient as long as there was even chance. She taught him that being a medic wasn't about following protocols. It was about being willing to do whatever it took to keep someone breathing. Vincent paused his mopping and leaned against the wall, his eyes closed. He could still hear her voice in his head, calm and steady even when everything was chaos. "Talk to me, Vince. What are you seeing? What's your plan?" She never just gave him answers. She made him think, made him grow, made him into someone capable of handling anything that came through the door of their makeshift surgical tent. The day she died was September 14th, 2011. Vincent remembered every detail with the clarity of a photograph that never faded. They had been operating on 2 patients simultaneously, both Afghan National Army soldiers wounded in a Taliban ambush. Sarah was working on the more critical case, a chest wound with significant bleeding. Vincent had the abdominal trauma, complicated but manageable. They were talking through their procedures, checking in with each other, working in the rhythm they had perfected over 3 years. The mortar round hit the perimeter fence first. Vincent heard the explosion, felt the concussion wave, but his hands never stopped moving. They had worked through indirect fire before. The second round hit closer. Sarah called out that she was almost done, just needed to get the chest tube secured. The third round came through the roof of the surgical tent. Vincent didn't remember the sound. He remembered the world turning white and then red. He remembered being thrown sideways, his patient sliding off the table. He remembered the ringing in his ears and the taste of dust and blood. And he remembered seeing Sarah on the ground 6 feet away with shrapnel embedded in her abdomen. He had abandoned his patient, left him on the floor bleeding, and crawled to Sarah through debris and blood and shattered equipment. Her eyes were open and focused on his face. She tried to speak, but couldn't at first. Vincent's hands moved automatically, assessing the wound, already knowing it was catastrophic. The shrapnel had torn through her liver and possibly her inferior vena cava. He needed a surgical team and an operating room and blood products. He had none of those things. He tried anyway, packed the wound with every piece of gauze he could find, applied pressure, screamed for a medevac, started in 4-line with hands that were finally shaking, held her and told her to hang on, that help was coming, that she was going to make it. All the lies that medics tell when they know the truth but can't accept it. Sarah's hand found his and gripped it with surprising strength. She coughed and blood came with it. Her voice, when it came, was barely a whisper. "Not your fault, Vince. Never your fault. You're the best I've ever seen. Don't stop. Promise me you won't stop." He had promised, held her hand and promised he would keep saving lives, keep being Lifeline, keep making her proud. She died 3 minutes later while he was still trying to stop the bleeding. The medevac arrived 5 minutes after that. His other patient survived, stabilized by the corpsman who had run in when the mortars hit. Vincent sat in the destroyed surgical tent covered in Sarah's blood and understood that he had failed at the only thing that mattered. They gave him a medal, sent him to Walter Reed for evaluation, diagnosed him with post-traumatic stress, and started him on therapy. But Vincent knew the truth that the therapist couldn't fix. He had spent 3 years learning to be good enough to handle anything. And when it mattered most, when the person he cared about needed him to be perfect, he had failed. The skills that saved strangers couldn't save her. All his training and experience and determination meant nothing when the shrapnel came through that tent roof. He stopped practicing medicine, refused the offers to work in military hospitals or civilian trauma centers, turned down teaching positions, drifted away from everyone who knew him as Lifeline, and disappeared into the anonymous mass of people who stocked shelves and cleaned floors and tried to forget who they used to be. For 4 years, he moved between temporary jobs and shelters and park benches, carrying nothing but a backpack with Sarah's photograph and the dog tags he couldn't bring himself to remove. 18 months ago, he had found the job posting for a janitor position at Metropolitan General. He had applied knowing that working a hospital would be torture, that every patient would remind him of what he had lost. But something in him needed to be close to medicine, even if he could never practice it again. Needed to hear the codes and see the trauma bays and smell the antiseptic. Needed the daily reminder of his failure, so he wouldn't forget why he didn't deserve to be anything more than the man who mopped up blood. Vincent opened his eyes and looked down at his hands. The same hands that had held Sarah while she died. The same hands that had performed over 300 field surgeries. The same hands that now gripped a mop handle and emptied trash bins and touched nothing more critical than a cleaning rag. Some nights, he went to the cemetery where Sarah was buried and knelt by her headstone and apologized for breaking his promise. Told her about the patients he watched through glass partitions, the ones he could have saved but didn't because he had given up the right to call himself a medic. The overhead speaker crackled again. Code Blue, Trauma Bay 3. Code Blue, Trauma Bay 3. Vincent's head snapped up. The teenager, Jason Miller. He dropped the mop and moved toward the trauma bay without thinking, then stopped himself. He wasn't part of the code team. He was just the janitor, just the old man who wasn't supposed to contaminate the clinical areas. He pressed himself against the wall and watched through the glass as the room filled with doctors and nurses responding to the cardiac arrest. Dr. Townsend was already inside, calling for the crash cart, starting chest compressions. Vincent's eyes tracked every movement, his brain automatically processing what he was seeing. The monitor showed ventricular fibrillation. They would shock him, push medications, try to restore a viable rhythm. But Vincent could see something they were missing. The way the teenager's chest wasn't moving properly on one side. The subtle deviation of his trachea. The distension of his neck veins. Classic signs of tension pneumothorax. A collapsed lung creating pressure that was crushing his heart and major vessels. They needed to decompress that chest immediately. Needed a large bore needle between the ribs to release the trapped air. It was a simple procedure, one that Vincent had performed dozens of times in combat. He could do it in less than 30 seconds. But his hands stayed at his sides and his feet stayed planted against the wall because janitors didn't perform life-saving procedures. Because he had promised himself he would never touch a patient again. Because Sarah's blood was still on his hands, even though he had washed them 1,000 times. Through the glass, Jason Miller's mother was being held back by security, her screams cutting through the controlled chaos of the code. Vincent closed his eyes and saw Sarah's face. Heard her voice. Don't stop. Promise me you won't stop. When he opened his eyes again, his hands were curled into fists so tight his knuckles had gone white. The code alarm continued its steady pulse, a rhythm Vincent knew too well from too many desperate moments. He watched through the glass partition as Dr. Townsend positioned the defibrillator paddles over Jason Miller's chest. Clear. The teenager's body jerked with the electrical shock. The monitor showed a brief, organized rhythm, then dissolved back into chaotic fibrillation. Dr. Townsend ordered another round of medications, his voice carrying the practiced authority of someone accustomed to being obeyed without question. Vincent's fingers traced the pattern of a needle decompression in the air, muscle memory so ingrained that his body couldn't stop the motion even when his mind tried to. Second intercostal space, mid-clavicular line, perpendicular to the chest wall. 30 seconds to execute. He had done it in moving helicopters in the dark while taking fire. He could do it now in a well-lit trauma bay with all the proper equipment. But he couldn't, had given up that right when he failed to save the one person who mattered most. Nurse Ramirez appeared at his shoulder, so suddenly he flinched. Her dark eyes studied his face with an intensity that made him uncomfortable. "You're not just watching, are you?" The question hung between them, accusatory and perceptive. Vincent tried to retreat, to slip back into his invisibility. "I should get back to my cleaning. I'm in the way here." Her hand caught his arm before he could leave. The touch was gentle but firm. "Stay, just for a minute." Something in her tone made him pause. She was still looking at his face, reading something there that he thought he had hidden. Then her eyes dropped to where his fingers were still unconsciously moving through the steps of a medical procedure. "Where did you learn to do that?" Vincent pulled his hand away, tucked both hands into the pockets of his work pants. "I don't know what you mean." But his voice came out wrong, too steady and controlled. The voice of someone who had talked soldiers through their fear, who had given orders in crisis situations. Not the voice of a janitor who just mopped floors. Ramirez didn't push, but she didn't leave either. She turned back to watch the code through the glass. They had been working on Jason for 3 minutes now. His color was getting worse, the grayish pallor that Vincent recognized as the visible marker of inadequate perfusion. The oxygen wasn't reaching his tissues because his heart couldn't pump effectively with a collapsed lung pressing against it. Dr. Townsend called for another shock. 300 joules this time. The teenager's body arched off the table. Nothing. The flat line on the monitor mocked their efforts. A resident suggested they try a different medication combination. Dr. Townsend snapped at him. "I know what I'm doing. Just keep up the compressions and let me work." Vincent's jaw clenched. He could see the mistake unfolding in real time. All the medications and electricity in the world wouldn't help if they didn't address the underlying mechanical problem. The trapped air needed to be released. The lung needed to re-expand. It was basic trauma management, the kind of thing that should have been caught on the initial assessment. But in the chaos of a mass casualty event with multiple critical patients, sometimes even experienced physicians miss the obvious. A medical student stood in the corner of Trauma Bay 3, taking notes on a clipboard. Vincent could see her face, the recognition dawning as she watched the monitor and the patient's chest wall. She had noticed something. Her pen moved quickly across her notes. But when she opened her mouth to speak, Dr. Townsend was already issuing another set of orders in his commanding voice. The student hesitated, closed her mouth, and went back to her notes. The hierarchy of medicine had silenced her observation before it could save a life. Vincent wanted to scream, wanted to shatter the glass partition and push through the door and show them what they were missing. His hands ached with the need to act, to be useful, to be lifeline again. But he had walked away from that identity, had decided that a man who failed his partner didn't deserve to wear the title of healer. More staff arrived as the code continued. A respiratory therapist adjusted the ventilation bag, trying to force more oxygen into lungs that couldn't expand properly. A pharmacy resident showed up with additional medications. The room was filling with people, all of them focused on the dying teenager, none of them seeing what Vincent saw with painful clarity. Ramirez leaned closer to him, her voice low enough that only he could hear. "You know what's wrong with him? I can see it in your face. Tell me." Vincent shook his head. "I'm just a janitor. I don't know anything about medicine." The lie tasted bitter. He had never been good at lying, even when it was necessary for his own protection. "Your hands say different." Ramirez gestured to where his fingers had been moving through procedure steps again without his conscious awareness. "And the way you're watching that monitor, you're not seeing a dying patient. You're seeing a puzzle you know how to solve." Before Vincent could respond, the automatic doors at the end of the hallway burst open. An older woman in scrubs rushed toward them, her gray hair pulled back in a bun, her face set with determination. She was moving fast for someone who had to be in her late 60s, her stride purposeful. As she passed under the fluorescent lights, Vincent noticed the small pin on her collar. A caduceus surrounded by the words Vietnam Medical Service Corps. The woman slowed as she approached Trauma Bay 3, her eyes scanning the scene through the glass. Then her gaze shifted to Vincent standing against the wall with his cleaning cart. She stopped completely, her face going still with recognition that made no sense. He had never seen her before in his 18 months working at the hospital. She stepped closer to him, her eyes moving from his face to his hands to the faded work uniform he wore. Her voice when she spoke was barely above a whisper. "The way you stand, the way you watch. I've seen it before." Her eyes dropped to his forearm where his sleeve had ridden up slightly, revealing just the edge of his tattoo. "May I?" Vincent wanted to refuse, but found himself nodding instead. She gently pushed his sleeve higher, exposing the faded ink. Coordinates. A date. Initials. She traced the numbers with one finger, her hand trembling slightly. FOB Lightning. Kandahar Province. I was at Walter Reed when they brought in that soldier from the 2009 ambush. 14 hours of field surgery before the medevac could reach him. They said only one man could have kept him alive that long. She looked up at Vincent's face, tears forming in her eyes. They called him Lifeline. The world seemed to tilt. Vincent tried to step back, but the wall was already behind him. That was a long time ago. I'm not that person anymore. The older nurse, her name tag read Margaret Shun, smiled sadly. You don't stop being who you are just because you decide you're not worthy of it anymore. She glanced back at the code in progress. That boy in there is dying because they're treating the symptom instead of the cause. And you know exactly what they're missing. Vincent's throat felt tight. Even if I did, I'm not licensed. I'm not credentialed. I have no authority to intervene in patient care. Margaret's voice hardened. That boy's mother is watching her son die. She doesn't care about credentials. She cares about someone saving him. Through the glass, Dr. Townsend was showing signs of frustration. 5 minutes of CPR and nothing was working. He called for another medication, something that Vincent knew would be useless without addressing the pneumothorax. The teenager's lips were turning blue. His pupils would be dilating soon, the brain cells dying from lack of oxygen. Ramirez moved to stand on Vincent's other side. I don't know who you used to be, but I know you're not just a janitor. I've watched you for months. The way you reorganize the medical supplies when you think no one is looking. The way you check crash cart medications, even though it's not your job. The way your whole body tenses when you hear certain codes called. Vincent closed his eyes. He could feel both women watching him, waiting for him to make a choice. Could feel the weight of Jason Miller's life pressing against his chest like physical force. Could hear Sarah's voice in his memory, clear as if she were standing beside him. Don't stop. Promise me you won't stop. But he had stopped, had walked away, had spent 4 years convincing himself that he didn't deserve to save lives anymore, that his failure with Sarah disqualified him from ever being trusted with another human being's survival. The mop handle in his hand was proof of his penance. The floors he cleaned a daily reminder that some mistakes were too large to come back from. Dr. Townsend's voice cut through his thoughts. Time of death, 1742. Stop compressions. The words landed like a physical blow. Vincent's eyes snapped open. They were giving up, calling it, letting a 16-year-old boy die from a condition that could be fixed in 30 seconds. No. The word came out before Vincent could stop it. His voice carried across the hallway, loud enough that Dr. Townsend heard it through the glass partition. The chief's head turned, his eyes finding Vincent standing with the 2 nurses. His expression shifted from exhaustion to irritation in an instant. Dr. Townsend strode to the door of the trauma bay and yanked it open. His face was flushed, sweat beading on his forehead. Did you just say no to me? Did the janitor just question my medical judgment? Vincent felt Margaret's hand on his shoulder, steadying him. Ramirez stepped slightly forward, putting herself between Vincent and Dr. Townsend's anger. But Vincent's eyes were locked on the teenager, lying still on the table behind the doctor. On the mother being held back by security, her face destroyed by grief. On the medical team, starting to remove their gloves, accepting the death as inevitable. His hands moved to his sides, fingers curling and uncurling. Sarah's voice in his head. The memory of 300 field surgeries. The muscle memory that had kept soldiers alive in conditions that would have killed them without intervention. The knowledge that he could save this boy if he just had the courage to try. Dr. Townsend took a step toward Vincent, his voice rising. I asked you a question. Who do you think you are? Vincent's spine straightened for the first time in 18 months. His shoulders squared. The janitor's posture fell away, and something else took its place, something old and hard and unbreakable. When he spoke, his voice carried the weight of years spent holding lives in his hands. Someone who knows that boy doesn't have to die today. The silence that followed Vincent's words felt like the moment before an explosion. Dr. Townsend's face cycled through expressions, disbelief giving way to outrage. You need to leave this area immediately. Security will escort you out. He turned back toward the trauma bay, dismissing Vincent with a wave of a hand. This conversation is over. But Vincent didn't move. His feet stayed planted on the linoleum floor, his eyes fixed on Jason Miller's still form beyond the glass. The boy's chest wasn't moving. His skin had taken on the waxy pallor Vincent had seen too many times before. The monitor showed a flat line that should have been dancing with electrical activity. Everything was wrong, and everything was fixable, and no one was fixing it. Margaret Chin's voice cut through the tension. "Blake, listen to him. Just for 1 minute, listen." Dr. Townsend spun back around, his attention shifting to the older nurse with barely contained fury. "Margaret, you're retired. You have no authority here. And maintenance staff certainly don't get to question medical decisions." He pointed at Vincent. "This man cleans floors. He empties bedpans. He doesn't get an opinion on patient care." The smell of blood and antiseptic was overwhelming now, mixing with the industrial cleaner on Vincent's hands. His brain kept trying to pull him backward through time, to thrust him into memories he had spent years trying to bury. But this time he didn't fight it. This time he let the memory come, because maybe it held something he needed to remember. Afghanistan, July 2009. The memory crystallized with perfect clarity. A convoy had been hit by a complex ambush 30 kilometers from the nearest base. Multiple casualties, some critical. Vincent had been first on scene with his quick reaction force. The worst wounded was a sergeant named Paulo Reyes, 24 years old with a sucking chest wound and a pneumothorax that was killing him faster than the blood loss. Vincent had performed the needle decompression in the back of a moving vehicle while taking sporadic sniper fire. His hands had been steady as stone. He had felt the pop of the needle penetrating the chest wall, heard the rush of trapped air escaping, watched Reyes's color improve within seconds. By the time they reached the aid station, Reyes was conscious and talking. By the time the medevac arrived, he was stable enough for transport. He lived because Vincent had recognized the problem and fixed it immediately. Sarah had been at that aid station when they brought Reyes in. She had examined Vincent's work, checked the placement of the needle, reviewed everything he had done in the field. Then she had pulled him aside and said something he had never forgotten. "You have a gift, Vince. Not just the technical skill, the ability to see what others miss and act without hesitation. That's what separates good medics from legends." He had believed her then, had carried those words through 2 more years of deployments and impossible surgeries and moments when lives hung on the edge of his decisions. Had believed he was good enough, skilled enough, worthy enough to hold that responsibility. Right up until the moment he held Sarah's hand and watched her die, because his gift hadn't been enough to save her. Vincent blinked and the memory released him. He was back in the hospital hallway with Dr. Townsend glaring at him and Margaret watching with steady confidence, and Ramirez standing close enough that he could feel her presence like a shield. His voice when he spoke was quieter than before, but no less certain. "That boy has a tension pneumothorax. Left side. His trachea is deviated. His neck veins are distended. His chest wall isn't moving symmetrically. You missed it because you were focused on the cardiac arrest instead of looking for the cause." Dr. Townsend's laugh was sharp and ugly. He stepped closer to Vincent, invading his space with practiced intimidation. "You're diagnosing patients now? Based on what medical training exactly? What degree do you have hanging on your wall?" "None." Vincent's admission was simple, unashamed. "I don't have any degrees. But I performed this exact procedure 47 times in combat conditions. I've saved 47 soldiers who presented with the same symptoms that boy is showing. And I'm telling you that if you decompress his chest, his heart will start beating again." The lie, when it came, was so casual that Vincent almost missed it, Dr. Townsend turned to the medical team, still standing around Jason's body. We already ruled out pneumothorax. His lung sounds were equal bilaterally on the initial exam. This was cardiac in origin, likely from the blunt force trauma to his chest. He's gone. There's nothing more to be done. Margaret made a sound of disgust. Blake, you didn't auscultate that patient yourself. I watched through the glass. The resident did the initial assessment while you were managing Trauma Bay 1. And with all the ambient noise from the mass casualty, bilateral breath sounds would have been nearly impossible to assess accurately. Dr. Townsend's face flushed darker. I don't have to defend my medical decisions to retired nurses and janitors. His voice rose to carry across the emergency department. This patient received the highest standard of care available. The fact that he didn't survive is tragic, but not the result of any failure on our part. Vincent thought about Sarah again, about the way she had taught him to trust his assessment skills, to believe in what he saw even when others questioned him. She had drilled it into him during their 3 years together. Your eyes and hands are diagnostic tools. Learn to trust them. When you see something wrong, speak up. It doesn't matter if you're the lowest ranking person in the room. A dead patient doesn't care about hierarchy. He had spoken up countless times in field hospitals and aid stations, had challenged doctors and senior medics when he saw them missing something critical. Sarah had backed him every time, had created an environment where observations from any team member were valued over ego and rank. It was one of the reasons their surgical team had such an exceptional survival rate. But he wasn't in a field hospital now. He was in a civilian emergency department where credentials mattered more than capability, and a janitor questioning a chief of medicine was unthinkable. Dr. Townsend had the power to have him arrested for interfering with patient care, could end his job with a phone call, could make him disappear back into the anonymous mass of people who cleaned hospitals and stocked shelves and carried the weight of their failures in silence. Vincent looked past Dr. Townsend to Jason Miller's mother. She had stopped screaming. Now she just stood there supported by security guards, her body shaking with silent sobs. Her son was dead at 16 because the man in charge had missed a diagnosis and refused to admit the possibility of error. Because ego had been valued over truth. Ramirez shifted beside Vincent. Her voice was steady when she spoke. Dr. Townsend, I've worked in this emergency department for 8 years. I've never seen you make a mistake. You're brilliant at what you do. But everyone misses things sometimes, especially in mass casualty situations. What's the harm in checking? What's the harm in inserting a needle just to rule it out? The trap in her words was elegant. She had praised him first, acknowledged his expertise, made space for him to change course without losing face. It was the kind of diplomatic navigation that Sarah would have used when dealing with difficult physicians. For a moment, Vincent thought it might work. Then Dr. Townsend shook his head. The harm is wasting time on a dead patient when we have 5 more critical cases that need my attention. The harm is allowing unqualified staff to interfere with medical decisions. The harm is setting a precedent that anyone can walk in off the street and second-guess trained physicians. He turned to the security guard who had been holding Jason's mother. Remove this man from the clinical area. If he resists, call the police. He's trespassing and interfering with patient care. The guard, a young man who looked uncomfortable with the entire situation, took a step toward Vincent. Sir, I'm going to have to ask you to come with me. Vincent's hands were shaking now, not from fear, but from the sheer physical effort of keeping them at his sides. Every instinct he had was screaming at him to push past the guard, to go to that teenager, to do what needed to be done. His fingers itched for the feel of a large-bore needle, for the resistance of tissue giving way, for the sound of trapped air escaping and life returning. Margaret moved to block the guard's path. Her voice carried authority that came from decades of service. That boy is still warm. His pupils haven't fixed yet. Brain death hasn't occurred. There's still a window. Dr. Townsend's voice was ice. Margaret, if you continue to interfere, I'll have you removed as well. I don't care about your service record or your years in this hospital. This is my emergency department, and my decisions are final. Vincent thought about the 14 hours he had spent keeping Sergeant Reyes alive during that convoy evacuation. Thought about the girl with shredded intestines who had lived because he and Sarah refused to give up. Thought about every soldier he had pulled back from the edge of death through sheer determination and skill. Thought about Sarah's last words. Don't stop. Promise me you won't stop. He had broken that promise when he walked away from medicine. Had broken it every day for 4 years while he mopped floors and watched patients die, who he could have saved. Had broken it so many times that he thought the promise itself had dissolved into nothing more than guilt and memory. But standing in this hallway with a dead teenager 10 feet away and the knowledge burning in his chest that he could bring that boy back, Vincent understood something. The promise hadn't dissolved. It had just been waiting for a moment like this. A moment when choosing silence meant betraying everything Sarah had taught him about what it meant to be a healer. The security guard reached for Vincent's arm. Vincent looked down at the young man's hand, then back up at his face. The guard hesitated, something in Vincent's eyes making him pause. Vincent's voice was soft, but it carried. I'm going to save that boy now. You can arrest me after. But I'm not leaving until he's breathing. The security guard's hand hovered near Vincent's arm, but didn't make contact. The young man's eyes shifted between Vincent's face and Dr. Townsend, caught between conflicting authorities. Vincent could see the uncertainty there, the recognition that something larger than hospital protocol was unfolding in this hallway. Dr. Townsend's voice cracked like a whip. I gave you an order. Remove him. Now. But before the guard could move, another voice joined the confrontation. Wait. Everyone, just wait a minute. A woman emerged from the cluster of staff near Trauma Bay 2, her white coat marking her as one of the attending physicians. Dr. Lisa Kovacs, according to her name badge. She was in her late 40s with tired eyes that suggested she had seen too many codes go badly. She approached the group with her hands raised in a gesture of peace. Blake, what's going on here? Dr. Townsend gestured dismissively toward Vincent. Maintenance staff overstepping their boundaries, questioning medical decisions, creating a scene during a mass casualty incident. I want him removed immediately. Dr. Kovacs studied Vincent for a long moment. Her gaze was different from Dr. Townsend's contempt. She was actually looking at him, seeing him as a person rather than an obstacle. What medical decisions are being questioned? Margaret Shin spoke before Vincent could. The janitor believes the teenager in Trauma Bay 3 has a tension pneumothorax that was missed during the code. He's suggesting the cardiac arrest was secondary to the mechanical problem. Dr. Kovacs's eyebrows rose. She glanced through the glass partition at Jason Miller's still form. We called the code 6 minutes ago. Are you suggesting we restart resuscitation efforts? Vincent found his voice, steadier now, that someone seemed willing to listen. I'm suggesting that if you decompress his left chest, you might find his heart starts beating again. The presentation is classic for tension pneumothorax. Tracheal deviation, distended neck veins, absent breath, sounds on the affected side. It was missed in the chaos of the initial assessment. Dr. Townsend made a sound of disgust. This is absurd. I'm not going to stand here and debate medicine with someone who has no medical training. Lisa, help me get this man out of here so we can focus on patients who actually need our help. But Dr. Kovacs wasn't moving. She was still watching Vincent with that same assessing gaze. What's your name? Vincent Chun. The words felt strange in his mouth. He had been invisible for so long that giving his real name felt like exposure, like stepping into light after years of darkness. And you work here as a janitor? Dr. Kovacs asked. Yes, ma'am, but you have medical knowledge. Her statement wasn't a question. She could see it the same way Margaret and Ramirez had seen it. The way he held himself, the precision of his terminology, the confidence in his assessment despite the enormous pressure being applied to make him back down. Vincent's throat felt tight. I used to. A long time ago. Dr. Kovacs turned to Margaret. You vouch for him. Why? Margaret's voice was firm. Because I've seen the results of his work before. At Walter Reed. And because in 30 years of nursing, I've learned to recognize when someone knows what they're talking about, regardless of what uniform they're wearing. The emergency department had gone quiet around them. Other staff members had stopped their work to watch the confrontation. Medical students stood frozen with their clipboards. Nurses paused in doorways. Even the constant background noise of monitors and overhead pages seemed to have dimmed. Everyone was waiting to see how this impossible situation would resolve. Dr. Kovacs walked to the glass partition and looked at Jason Miller's body. She stood there for what felt like an eternity, her eyes moving from the teenager's face to his chest to the monitor that still showed a flat line. When she turned back, her expression was unreadable. "Blake, when was the last time you personally assessed this patient's breath sounds?" Dr. Townsend's face flushed. "I supervised the initial assessment. My resident performed the auscultation while I was managing the airway in Trauma Bay 1. The findings were reported to me as bilateral breath sounds present in a mass casualty situation, with multiple victims arriving simultaneously, with significant ambient noise." Dr. Kovacs' voice was neutral, but her meaning was clear. "Are you questioning my judgment?" Dr. Townsend's voice rose again. "I'm the chief of this department. I've been practicing emergency medicine for 15 years. And you're going to take the word of a janitor over mine? I'm taking the word of my own eyes." Dr. Kovacs pointed through the glass. "Look at his trachea, Blake. It's deviated to the right. Look at his neck veins. They're distended. And his left chest wall shows decreased excursion compared to the right." She turned back to Vincent. "Those are the signs you saw?" "Yes, ma'am, along with the mechanism of injury. Passenger side impact in a motor vehicle collision. Classic setup for traumatic pneumothorax that can progress to tension pneumothorax if not recognized and treated." Dr. Kovacs nodded slowly. She pulled her phone from her coat pocket and started typing. "I'm documenting this conversation. The timestamp, the observations, all of it." Then she looked directly at Dr. Townsend. "I'm going to examine that patient myself. And if I find evidence of tension pneumothorax, I'm going to decompress his chest. Do you have any objection to that?" The trap was perfect. If Dr. Townsend objected to another physician examining a patient, he would look unreasonable. If he allowed the examination and the pneumothorax was confirmed, his failure to diagnose, it would be documented. Either way, his authority was being challenged in front of the entire department. Dr. Townsend's jaw worked silently for a moment. "Fine. Examine him. Waste everyone's time. But when you find nothing, I expect an apology from all of you. And I expect this man," he jabbed a finger toward Vincent, "terminated immediately for insubordination and interference with medical care." Dr. Kovacs didn't acknowledge the threat. She was already moving toward Trauma Bay 3, pulling on fresh gloves as she walked. Margaret followed her without being asked. Ramirez moved to join them, but paused beside Vincent first. Her hand found his and squeezed briefly. "Whatever happens, you did the right thing." Vincent couldn't respond. His throat had closed completely. He watched through the glass as Dr. Kovacs approached Jason Miller's body with Margaret at her side. The older nurse was already gathering supplies, anticipating what might be needed. A large bore needle, betadine solution, sterile gloves. The tools of emergency chest decompression laid out with practiced efficiency. Dr. Kovacs began her examination methodically. Her hands palpated Jason's neck, feeling for the position of his trachea. Vincent saw the moment she confirmed the deviation. Her eyes widened slightly. She moved to the chest, placing her hands on both sides to assess for symmetrical movement. Even without respirations, she could feel the difference in chest wall compliance. Her stethoscope came out next, pressing against each side of the teenager's chest, even though there were no breath sounds to hear. She was checking for the quality of silence, the subtle differences that might indicate trapped air. Vincent had stopped breathing. His entire world had narrowed to the scene beyond the glass. This was the moment. Either Dr. Kovacs would confirm his assessment and he would be vindicated, or she would find nothing and he would be revealed as a delusional former medic clinging to obsolete knowledge and unearned authority. Dr. Kovacs straightened. She looked through the glass directly at Vincent. Her expression was grim. Then she turned to Margaret. "Set up for needle decompression. Left chest, second intercostal space, midclavicular line. And get the defibrillator ready. If we decompress successfully, we're going to need to shock him immediately." The emergency department exploded into motion. Nurses rushed to assist. The medical students pressed closer to the glass to watch. Dr. Townsend stood frozen in the hallway, his face cycling through emotions too quickly to track. Vincent felt his knees go weak. He reached out to steady himself against the wall. Margaret's hands moved with the precision of someone who had set up for this procedure hundreds of times before. She swabbed Jason's chest with betadine, the orange solution stark against his pale skin. Dr. Kovacs positioned herself at the bedside, the large-bore needle held with absolute certainty. She palpated the landmarks one more time, confirming her position. Second rib, intercostal space, midclavicular line. Vincent's lips moved silently, walking through the procedure with her. Perpendicular angle to the chest wall. Steady pressure. Listen for the pop of the pleura. Feel for the rush of air. Dr. Kovacs drove the needle home with controlled force. For one terrible second, nothing happened. Then Vincent heard it, even through the glass partition. The hiss of trapped air escaping under pressure. A sound he had heard 47 times before in dusty aid stations and damaged helicopters and surgical tents lit by generator-powered lights. The sound of life returning where death had claimed victory. Jason Miller's chest wall shifted, expanded, found its natural position again. The pressure that had been crushing his heart and major vessels released all at once. Dr. Kovacs held the needle steady, letting the trapped air escape completely. She looked at the monitor. Still flatline. But that could change. Dr. Kovacs pulled the needle free and immediately began chest compressions. Margaret charged the defibrillator. Other staff moved in to assist, falling into the choreography of a code with renewed purpose. The room transformed from a place of defeat to a place of possibility. Clear. Dr. Kovacs stepped back. Margaret delivered the shock. Jason's body jerked. The monitor showed a brief flicker of electrical activity. Then nothing. Dr. Kovacs resumed compressions. Push another round of epinephrine. Prepare for another shock. Her voice carried none of Dr. Townsend's theatrical authority. Just calm determination. Another shock. Another flutter on the monitor. This time the flutter lasted longer, organized into a rhythm. The line began to dance with the unmistakable pattern of a heartbeat. We have a pulse. Margaret's voice cracked with emotion. We have a pulse. Check for spontaneous respirations. Vincent watched Jason Miller's chest rise and fall on its own. Watched color begin to return to his face. Watched the monitor display vital signs that 15 minutes ago had been absent. Watched a dead teenager come back to life because someone had listened to a janitor who used to be a medic. He slid down the wall until he was sitting on the floor, his back pressed against the cold surface. His hands were shaking violently now. Ramirez knelt beside him, her hand on his shoulder. Vincent couldn't speak, could barely breathe, could only watch through the glass as the miracle he had predicted unfolded exactly as he had known it would. The chaos and trauma bay 3 shifted from desperate resuscitation to cautious stabilization. Vincent watched through the glass as the team worked to secure what they had just reclaimed. Jason Miller's heart was beating, but the fight wasn't over. Dr. Kovacs called for a chest tube to replace the emergency needle decompression, for imaging to assess other injuries, for consultation with the trauma surgery team. The teenager was alive, but fragile, balanced on the knife edge between recovery and relapse. Vincent couldn't stand yet. His legs felt like water. The adrenaline that had carried him through the confrontation was draining away, leaving exhaustion in its wake. Ramirez stayed beside him, her presence steady and silent. She didn't try to make him talk or move. She just sat with him on the floor while the emergency department swirled around them. Dr. Townsend had disappeared. Vincent noticed his absence with distant awareness. The chief had been standing in the hallway when Jason's heart restarted, had witnessed the impossible reversal, and then had simply turned and walked away. His white coat had vanished around a corner, and no one had called him back. The victory was complete in his absence. Margaret emerged from Trauma Bay 3, stripping off her gloves. Her face was flushed with exertion and emotion. She knelt in front of Vincent with surprising grace for someone her age. Her hands found his and held them firmly. "You brought him back." That boy was dead, and you brought him back. Vincent shook his head. Dr. Kovacs brought him back. She did the procedure. Margaret's grip tightened. Don't you dare diminish what you did. You saw what no one else saw. You spoke up when it would have been easier to stay silent. You risked everything to save a stranger's child. That's what being a medic means. That's what being Lifeline means. The name hit him like a physical blow. He had buried that call sign along with everything else from his past. Hearing it spoken aloud in a civilian hospital felt surreal, like two incompatible worlds colliding. I'm not Lifeline anymore. I'm just Vincent, just a janitor who got lucky. Margaret released his hands and sat back on her heels. Her eyes were wet, but her voice was steel. I was a nurse in Vietnam. I worked in field hospitals where boys not much older than that teenager in there came in torn apart by things you couldn't imagine. I watched medics work miracles with almost nothing, and I learned to recognize the ones who had the gift. She pointed at the trauma bay. What you did today wasn't luck. It was skill and experience and courage. It was everything you were trained to be. Dr. Kovacs appeared in the doorway of Trauma Bay 3, pulling off her surgical mask. She scanned the hallway and found Vincent still sitting against the wall. She approached with deliberate steps, her face unreadable. Vincent tried to stand, but his body wouldn't cooperate. Dr. Kovacs waved him down. Stay there. We need to talk. She lowered herself to sit on the floor beside him, her white coat pooling around her. For a moment, she just sat there, staring straight ahead. Then she spoke. I've been an emergency physician for 22 years. I've seen thousands of traumas, and I missed that pneumothorax. She turned to look at Vincent. You didn't. Why? Vincent's voice came out hoarse. Because I've seen it before. Too many times. In conditions where missing it meant soldiers died. You learn to look for it automatically. To check for it, even when everything else is screaming for your attention. What's your medical background? Dr. Kovacs asked. Special Forces Medical Sergeant. 18 Delta. Multiple deployments to Iraq and Afghanistan. Field surgical experience working with forward trauma teams. Vincent paused, his throat tightening. I separated from service in 2011. Haven't practiced medicine since. Dr. Kovacs was quiet for a long moment. That's a lot of training and experience to walk away from. What happened? Vincent closed his eyes. Lost someone I couldn't save. Decided I didn't deserve to be trusted with lives anymore. So you spent the last several years mopping floors in a hospital. Dr. Kovacs' voice held no judgment, just observation. Watching patients. Seeing things the medical staff missed. Staying silent because you convinced yourself you didn't have the right to speak. Pretty much. Vincent opened his eyes and looked at her. Until today. Dr. Kovacs nodded slowly. That boy's mother is in the family room right now. She's crying because her son is alive when 10 minutes ago we told her he was dead. She doesn't know your name yet. Doesn't know you're the reason she still has a child. But she will. Because I'm going to tell her. Vincent felt panic rise in his chest. Please don't. I don't need recognition. I just needed him to live. Too late. Dr. Kovacs pulled out her phone and showed him the screen. I documented everything. The timestamp of your assessment. Your specific observations. My confirmation of your diagnosis. The successful intervention. It's all in the medical record now. She looked at him seriously. You saved that boy's life. That's not something you get to hide from. The automatic doors opened and hospital administration arrived. A man in an expensive suit, his hospital ID marking him as Robert Chun, Chief Operating Officer. He moved with the brisk efficiency of someone accustomed to managing crises. His eyes swept the scene, taking in Dr. Kovacs, sitting on the floor with Vincent, Margaret standing nearby, the cluster of staff still watching from Trauma Bay 3. Someone want to tell me what's happening in my emergency department? His voice carried authority, tempered with genuine concern. I got 3 separate calls about a code that was reversed, a conflict between attendings, and something about a janitor saving a patient. Dr. Kovacs stood, brushing off her coat. Bob, you're going to want to hear this. All of it. She gestured to Vincent. This is Vincent Chun. He works in environmental services. He's also a former Special Forces medic with extensive combat trauma experience. 20 minutes ago, he identified a missed diagnosis that saved a teenage patient's life. The COO's eyebrows rose. He looked down at Vincent with new attention. You're the janitor who challenged Blake Townsend's medical judgment? Vincent finally managed to stand, using the wall for support. His legs were steadier now. I saw a patient who was dying from a treatable condition. I spoke up. Robert Chin studied him for a long moment. Then he pulled out his own phone and started typing rapidly. I need Dr. Townsend in my office immediately. I need the complete medical record for the patient in Trauma Bay 3. I need a formal incident report from everyone involved. He looked up at Dr. Kovacs. And I need your professional assessment of what happened here. Dr. Kovacs' response was immediate and clear. Mr. Chun was correct in his diagnosis. I confirmed the tension pneumothorax upon examination. The patient would have remained deceased if not for his intervention. His medical knowledge is extensive and his assessment skills are exceptional. The COO turned his attention back to Vincent. Why are you working as a janitor with those qualifications? Because I failed when it mattered most. Vincent's answer was simple and honest. I lost someone, a surgeon I worked with. She died and I couldn't save her. I walked away from medicine because I didn't trust myself anymore. Robert Chin's expression softened slightly. I'm sorry for your loss, but you understand that what happened today changes everything. You can't go back to being invisible after this. There will be questions, reviews, potentially legal issues given that you intervened in patient care without credentials or privileges. Vincent nodded. I know. I'm prepared to accept the consequences. The COO looked surprised. You're not going to fight this? No, sir. That boy deserved to live. Whatever happens to me, because I made sure he did, I can live with that. Margaret stepped forward. Bob, before you make any decisions, you should know who Vincent really is. She pulled out her own phone and pulled up a web page. This is from the Walter Reed Medical Center archives. The 2009 convoy ambush evacuation. 14 hours of continuous field surgery. Multiple casualties kept alive against impossible odds. The medic they called Lifeline. Robert Chun took her phone and read the screen. His eyes widened as he scrolled through the article. Then he looked at Vincent with something approaching awe. This is you? This is actually you? Vincent wanted to deny it, but couldn't. Yes, sir. That was me. A long time ago. The COO handed the phone back to Margaret. He pulled out his own phone again and made a call. This is Robert Chun. I need to speak with the chief of staff immediately. Tell him it's urgent. He paused, listening. I don't care if he's in surgery. Page him. This can't wait. Vincent felt the world tilting again. Everything was moving too fast. He had spent 4 years invisible, and now he was the center of a storm he couldn't control. Ramirez appeared at his elbow, steadying him. You okay? No, but I will be. Vincent took a breath. Is Jason stable? Ramirez nodded. They're taking him up to the ICU. His vitals are holding. They think he's going to make it. The relief that washed through Vincent was profound. He had saved the boy. Whatever else happened, whatever consequences followed, Jason Miller was alive, and that was enough. It had to be enough. Through the glass partition, he could see the trauma team preparing to transport Jason. The teenager was intubated and sedated, surrounded by monitors and 4 pumps and all the technology of modern medicine. But he was breathing. His heart was beating. Blood was flowing to his brain and organs. He had a future again because Vincent had found the courage to break his silence. Margaret stood beside him, following his gaze. You kept your promise to her. To Dr. Martinez. You didn't stop. You came back when it mattered. Vincent's vision blurred with tears he couldn't hold back anymore. Sarah's voice in his memory. Don't stop. Promise me you won't stop. He had broken that promise 1,000 times over 4 years of running. But today, finally, he had kept it, had been who she needed him to be, had saved a life the way she had taught him to. Robert Chun ended his call and approached Vincent again. The chief of staff is coming down. We need to discuss your status here, your employment, your medical credentials, everything. But first, he extended his hand. I need to say thank you. On behalf of the hospital and that boy's family. You did something extraordinary today. Vincent shook his hand, his own still trembling slightly. I just did what I was trained to do. The COO smiled sadly. Most people with your training would have stayed silent to protect themselves. You didn't. That makes all the difference. The chief of staff arrived within 15 minutes, still wearing surgical scrubs with his mask hanging around his neck. Dr. Ramon Pacheco was in his early 60s with silver hair and the weathered look of someone who had spent decades making impossible decisions. He listened to Dr. Kovacs's account without interrupting, his eyes moving between her face and Vincent's. When she finished, he was silent for a long moment. Let me make sure I understand. Dr. Pacheco's voice was measured and careful. A patient was declared deceased after a code. Our janitor, who happens to be a former Special Forces medic, diagnosed a mistension pneumothorax from outside the trauma bay. Dr. Townsend refused to consider the possibility. Dr. Kovacs performed an independent assessment, confirmed the diagnosis, and successfully resuscitated the patient. Is that accurate? That's accurate. Dr. Kovacs held his gaze. The patient would still be dead if Mr. Chun hadn't spoken up. Dr. Pacheco turned his attention to Vincent. How long have you worked here? 18 months, sir. Vincent kept his voice steady. Environmental services. Night and day shifts as needed. And in those 18 months, how many times have you observed medical errors or misdiagnoses? Vincent hesitated. The question was a trap. If he said none, he was lying. If he gave a number, he was admitting to watching patients suffer without intervening. Dr. Pacheco saw the hesitation and nodded. You don't have to answer that. I can imagine it was more than once. Yes, sir. Vincent's throat felt tight. I saw things, but I didn't have the right to say anything. I was just the janitor. Just the janitor. Dr. Pacheco repeated the words softly, with more trauma experience than half my attending physicians. Watching patients die from treatable conditions because you convinced yourself you didn't deserve to help them. The words hit like punches. Vincent wanted to defend himself, but had no defense to offer. Dr. Pacheco was right. He had watched people suffer in silence because his own guilt mattered more than their lives. It was a truth he had been avoiding for 18 months. Dr. Pacheco pulled out a chair from the nurse's station and sat down heavily. He gestured for Vincent to sit as well. Vincent lowered himself into another chair, aware that everyone in the emergency department was watching them. The chief of staff leaned forward, his elbows on his knees. I was a flight surgeon in the Air Force. First Gulf War. I saw combat medics work miracles with almost nothing. Saw them save lives that by all rights should have been lost. He paused. I also saw what happened to some of them afterward. The guilt, the survivor's remorse. The ones who couldn't forgive themselves for the people they couldn't save, even though they saved dozens of others. Vincent met his eyes. Sounds like you understand. I understand that trauma changes people, that sometimes the weight of what we've seen and done becomes unbearable. Dr. Pacheco's voice was gentle, but I also understand that hiding from that trauma doesn't make it go away. It just means more people die unnecessarily. The statement hung in the air between them. Vincent thought about all the patients he had watched over 18 months. The ones who coded and didn't come back. The ones who went septic because someone missed the early signs. The ones who bled out because interventions came too late. How many of them could he have saved if he had spoken up? How many families had lost people because his guilt mattered more than their suffering? Robert Chun rejoined the conversation. Dr. Pacheco, we need to address the immediate situation. Mr. Chun intervened in patient care without credentials or privileges. Dr. Townsend is demanding his termination and possibly legal action. We have liability concerns. Dr. Pacheco nodded. Blake's in my office right now, making those exact arguments. He's also threatening to resign if we don't fire Mr. Chun immediately. Vincent felt his stomach drop. I understand. I'll collect my things. You'll do no such thing. Dr. Pacheco's voice sharpened. Blake Townsend is a good physician, but he is a blind spot the size of Texas when it comes to his ego. He missed a diagnosis, refused to consider he might be wrong, and a patient died because of it. The fact that the patient came back doesn't erase the initial failure. Robert Chun shifted uncomfortably. Blake is our chief of emergency medicine. We can't just dismiss his concerns. I'm not dismissing them. I'm putting them in context. Dr. Pacheco stood and began pacing. Here's what I see. We have a patient who would be dead if not for Mr. Chen's intervention. We have documented evidence that his assessment was correct and that our attending physician missed a critical diagnosis. And we have a former military medic with extensive trauma experience working as a janitor because we failed to recognize what he could offer. Margaret spoke up from where she stood near the trauma bay. Dr. Pacheco, with respect, this isn't just about today. Vincent has skills this hospital desperately needs. Our trauma outcomes would improve significantly if he was part of the clinical team. The chief of staff stopped pacing and looked at her. You're suggesting we bring him on staff. I'm suggesting we find a way to utilize his expertise. Margaret's voice was firm. The VA has programs for combat medics transitioning to civilian healthcare. Special licensing pathways. He could be credentialed. Vincent raised his hand like a student in class, the gesture automatic and slightly absurd. With respect, nobody's asked me what I want. Dr. Pacheco smiled slightly. You're right. What do you want, Mr. Chun? Vincent looked through the glass partition at Trauma Bay 3. The room was empty now, Jason transported to the ICU. But he could still see the moment the boy's heart had restarted. Could still feel the overwhelming relief of knowing his intervention had worked. For the first time in 4 years, he had felt like Lifeline again. Like someone who saved lives instead of running from them. I want to stop being afraid. Vincent's voice was barely above a whisper. I want to stop hiding. I want to keep the promise I made to someone who believed I was better than I thought I was. Dr. Pacheco nodded slowly. Then let's figure out how to make that happen. He turned to Robert Chun. Bob, I need you to research every possible pathway for credentialing combat medics in California. Federal programs, state provisions, anything that might apply. I want options on my desk by tomorrow morning. The COO pulled out his phone and started making notes. What about Dr. Townsend's complaint? We'll address it through proper channels. A formal review of the incident. Documentation of the missed diagnosis. Assessment of his decision-making during the code. Dr. Pacheco's expression hardened. If Blake wants to make this about credentials and authority, then we'll examine whether his credentials and authority were used appropriately. I suspect he won't like what we find. Vincent felt the weight of expectations settling onto his shoulders. This was happening too fast. For hours ago, he had been invisible. Now the chief of staff was talking about bringing him onto the medical team. It was too much. Too sudden. He wasn't ready. But then he thought about Jason Miller breathing in the ICU. Thought about the mother who still had her son because Vincent had found his voice. Thought about Sarah's face when she talked about saving lives being the only thing that mattered. Ready or not, this moment had arrived. He could either step into it or retreat back into the shadows. Dr. Kovacs approached and handed Vincent a bottle of water. Drink something. You look like you're about to pass out. He took it gratefully, his hand still trembling slightly. She sat down beside him. I meant what I said before. You can't hide from this. That boy's mother is going to want to thank you. The media might pick up the story. Your life is about to get complicated. Vincent opened the water and took a long drink. It's already complicated. I've been living in my head for 4 years, arguing with ghosts, convinced I didn't deserve to be anything more than invisible. Maybe complicated is an improvement. Margaret knelt beside his chair. Her hand found his and squeezed. Sarah will be proud of you. For speaking up. For saving that boy. For finally letting yourself come back. The mention of Sarah's name brought tears to Vincent's eyes again. He didn't try to hide them. Do you really think she would be proud? Or would she be angry that it took me 4 years and a dying teenager to remember what she taught me? Both. Margaret smiled through her own tears. She'd be angry you wasted so much time, and proud you finally found your way back. That's how it works with the people who love us. Dr. Pacheco's phone buzzed. He glanced at it, and his expression tightened. Jason Miller's mother wants to know who saved her son. The ICU nurses told her it wasn't the original code team. She's asking questions. Vincent's heart rate spiked. I don't need to talk to her. Just tell her the medical team figured it out. Too late. Dr. Pacheco showed him the phone screen. She's on her way down here now. Someone told her it was the janitor. She wants to meet you. Vincent stood abruptly, panic flooding through him. I can't. I'm not ready for this. Ramirez appeared at his side, her presence steadying. You don't have to be ready. You just have to be honest. Tell her what you saw. Tell her why you spoke up. She doesn't need perfect. She needs to thank the person who saved her son. Through the emergency department doors, Vincent could see a woman approaching. She was in her early 40s with Jason's eyes and tear-streaked makeup. She moved with the determination of someone who had just witnessed the impossible and needed to understand it. Behind her came two younger girls, Jason's sisters based on their resemblance. All three of them were looking around the emergency department, searching. A nurse pointed toward Vincent. The mother's eyes locked onto him. She started walking faster. Vincent wanted to run, wanted to disappear into the supply closet or the stairwell or anywhere that wasn't here. But his feet wouldn't move. He stood frozen as Jason Miller's mother crossed the emergency department with her daughters following. She stopped in front of him, her eyes searching his face. "Are you the one? The janitor who knew my son was still alive?" Vincent couldn't speak, could only nod. The mother's face crumpled, and she stepped forward and wrapped her arms around him in a fierce embrace. Her voice broke as she spoke into his shoulder. "Thank you. Thank you for not giving up on him. Thank you for knowing. Thank you for fighting when everyone else stopped." Vincent's arms came up automatically, returning the embrace. This woman was crying on him, thanking him, treating him like a hero when he felt like anything but. Her daughters moved closer, their hands reaching out to touch his arm, his shoulder, needing physical confirmation that he was real. The mother pulled back, her hands gripping his arms. "What's your name? I need to know your name." "Vincent Shun." His voice came out rough. "I'm just a janitor here. I saw something the doctors missed, and I spoke up. You're not just anything." The mother's voice was fierce. "You're the reason my son is alive. You're the reason I still have my baby. Whatever else you are, you're that first." Vincent stood in Jason Miller's mother's embrace and felt something inside him begin to crack. Not break, crack, like ice that had been frozen solid for years, finally experiencing warmth. The fissures spread through his chest, through the walls he had built around his guilt and shame, letting in light he didn't know he needed. "My name is Rebecca. Rebecca Miller." The woman pulled back but kept her hands on his arms, anchoring him. "These are my daughters, Emma and Sophia. Jason's sisters. They were at school when the accident happened. They got to the hospital just as the doctors were telling me he was gone." Emma, who looked about 14, wiped her eyes with the back of her hand. "Then they said he was alive again, that someone brought him back. We didn't understand how." Vincent looked at the three faces watching him with something approaching reverence. He wanted to tell them it wasn't a miracle, that it was just medical knowledge and pattern recognition, that any competent trauma physician should have caught the pneumothorax. But looking at their tear-stained faces, he understood that the technical details didn't matter to them. What mattered was that their son and brother was breathing when he shouldn't be. "I just saw something the other doctors missed." Vincent tried to keep his voice steady. "I've seen that kind of injury before. I knew what to look for." Rebecca shook her head firmly. "You did more than that. You fought for him. The nurse told me you argued with the chief of medicine, that you risked your job to make them listen." Her voice broke again. Most people would have stayed quiet, kept their head down. You didn't. Sophia, the younger sister who couldn't have been more than 12, spoke up quietly. "Can we see him? Jason? Is he really okay?" Dr. Kovacs stepped forward. "He's in the ICU, still sedated, still critical, but his vitals are stable and the trauma team is optimistic. You can go up in a few minutes. The ICU nurse will come get you." Rebecca turned back to Vincent. "Will you come see him? When he wakes up, I want him to know who saved him. I want him to be able to thank you." The request felt impossible. Vincent imagined standing at Jason's bedside, looking at the teenager who had been dead and was now alive because of him. Would it feel like redemption? Or would it just remind him of all the people he hadn't saved? All the soldiers who died despite his best efforts? Sarah bleeding out while he held her? I don't know if that's a good idea. Vincent's voice came out strained. "I'm glad he's alive. That's enough for me. It's not enough for us." Rebecca's tone was gentle but unyielding. "Please, when he's ready, just a few minutes. Let us thank you properly." Before Vincent could respond, the automatic doors opened again and two men in suits entered the emergency department. One carried a camera. The other had a recorder and notepad. The hospital's public relations team, based on their identification badges and purposeful approach. The man with the notepad headed straight for Dr. Pacheco. Dr. Pacheco, we're getting calls from local news outlets. Someone posted on social media about a janitor saving a patient's life. It's already spreading. We need to get ahead of this with an official statement. Dr. Pacheco's expression remained neutral. No statement yet. This is an active medical situation with privacy concerns. We'll issue something when appropriate. The PR representative glanced toward Vincent and Rebecca Miller. With respect, the story is already out there. We can either control the narrative or let it control us. A feel-good story about a hero janitor could be excellent for the hospital's reputation. This isn't about reputation. Dr. Pacheco's voice hardened. This is about a patient who nearly died and the complex circumstances surrounding his resuscitation. We'll address it through proper channels, not sound bites for the 6 o'clock news. Vincent felt the world spinning faster. Social media, news outlets, his face and story plastered across the internet. The anonymity he had cultivated for 4 years shredding in real time. Everyone would know. Everyone would ask questions. Why was a trained combat medic working as a janitor? What happened to make him leave medicine? The questions would dig into wounds he had barely learned to live with. Rebecca noticed his distress. She squeezed his arm. You okay? You look pale. I just need some air. Vincent gently extracted himself from her grip. I'm sorry. I need a minute. He walked toward the emergency exit, not quite running, but close. Ramirez called after him, but he didn't stop. The door opened to a small courtyard behind the emergency department, a space where staff came to decompress after particularly brutal shifts. Vincent stumbled to a bench and sat heavily, his head in his hands. The door opened behind him. He expected Ramirez or Margaret. Instead, Dr. Kovacs settled onto the bench beside him. She didn't speak immediately, just sat there in companionable silence while Vincent tried to remember how to breathe normally. When I was a resident, Dr. Kovacs finally said, I lost a patient because I missed an obvious diagnosis. Diabetic ketoacidosis presenting atypically. I was so focused on the chest pain that I didn't see the metabolic crisis. By the time someone else caught it, the patient had already coded. We got her back, but she had a noxic brain injury. Lived the rest of her life in a nursing home. Vincent looked up at her. I'm sorry. Dr. Kovacs nodded. I almost quit medicine. Couldn't forgive myself for the mistake. Couldn't imagine being trusted with another patient's life. My attending at the time told me something I've never forgotten. She paused, choosing her words carefully. He said that medicine doesn't allow for perfection, only for learning. The only unforgivable mistake is the one you refuse to learn from. Vincent understood what she was trying to say, but it's not the same. You were a resident, learning. I was supposed to be expert level. Sarah trusted me to handle anything. And when it mattered most, I failed. Did you? Dr. Kovacs turned to face him fully. Or did a mortar round kill your partner despite everything you knew and everything you tried? There's a difference between failure and impossibility. I should have been faster. Better. Vincent's voice broke. I should have been able to save her. You were human. Dr. Kovacs' voice was gentle but firm. You did everything possible with what you had. And you've punished yourself for 4 years for not being superhuman. How much longer are you going to keep punishing yourself? Vincent didn't have an answer. The guilt was so ingrained that he couldn't imagine life without it. It had become part of his identity. The medic who failed. The man who let Sarah down. Without that guilt, who was he? Inside, Jason Miller is alive. Dr. Kovacs continued. Because you recognized what I missed. Because you spoke up when it would have been easier to stay silent. Because you remembered how to be lifeline even though you convinced yourself you didn't deserve to be. That's not failure. That's redemption. I don't feel redeemed. Vincent wiped his eyes. I feel terrified. Good. Dr. Kovacs smiled slightly. Fear means you understand the weight of what you're carrying. The doctors I worry about are the ones who aren't afraid. She stood. Take your time out here. But don't run. That family needs to thank you. And whether you believe it or not, you need to let them. She left him alone in the courtyard. Vincent sat with his head tilted back, looking at the sky. It was getting dark, the sun setting behind the hospital buildings. He thought about Sarah, about the promise he had made and broken and somehow, impossibly, kept today. She would have kicked his ass for hiding for 4 years, would have dragged him out of his self-imposed exile and forced him to remember who he was. But she would also have understood the fear, the weight of holding lives in your hands, the terror of making a mistake that couldn't be undone. She had carried that same weight for years, had made her own mistakes, had lost patience despite her best efforts. And she had kept going because the alternative was letting more people die. Vincent pulled out his phone, something he rarely used. He opened a Photos app and scrolled to the one picture he had saved. Sarah in her surgical scrubs, covered in blood and exhausted and smiling. Taken after a particularly brutal 24-hour shift where they had saved 6 critical patients against impossible odds. Her eyes in that photo held the same fierce determination he remembered. He touched the screen, tracing her face. Still here, Sarah. Still trying. I saved one today. A kid, 16 years old. He was dead, and I brought him back. You would have been proud. Or angry it took me so long to remember what you taught me. Probably both. The courtyard door opened again. This time it was Margaret. She approached slowly, giving him the option to send her away. Vincent gestured to the bench. She sat down with a soft sigh. They're taking Rebecca and the girls up to the ICU. Margaret's voice was quiet. She asked me to tell you that the offer stands. When you're ready, she wants you to meet Jason properly. Vincent nodded. Maybe when he wakes up. When he's stable. I don't know if I can handle it yet. That's fair. Margaret was silent for a moment. You know what today reminded me of? Why I became a nurse in the first place. She looked at him. I was 17 when the Vietnam War was at its peak. My brother was a Marine. Got wounded at Key San. The medic who kept him alive was 19 years old, barely trained, working in conditions I can't even imagine. But he refused to let my brother die. Carried him 300 meters under fire to get him to a helicopter. Vincent looked at her. Your brother survived? For 52 years after that day. Margaret smiled sadly. He died last year. Heart attack. But he got to live a full life. Got to get married, have kids, meet his grandchildren. All because a teenage medic refused to give up on him. She turned to Vincent. That medic's name was Bobby Torres. I never forgot it. I became a nurse because I wanted to be like him. Wanted to fight for people the way he fought for my brother. And today I watched you do exactly that. Fight for a stranger's child. Be what Bobby was for my family. Vincent felt the crack in his defenses widen. How do you carry it? The weight of knowing that people live or die based on what you do. You don't carry it alone. Margaret's hand found his. You let the people around you help. You forgive yourself for the ones you can't save. And you keep showing up because the alternative is unbearable. Vincent looked down at their joined hands. Margaret's were weathered like his own, marked by years of service. He thought about all the hands that had touched patients over the decades. Healing hands. Saving hands. Imperfect human hands that tried anyway. I don't know if I can go back to being a medic. His voice was barely audible. I don't know if I'm strong enough. You already did go back. Margaret squeezed his hand. The moment you spoke up for Jason. The moment you chose his life over your fear. That was you being Lifeline again. Everything else is just paperwork. Vincent returned to the emergency department with Margaret at his side. The shift had changed while he was outside. New nurses and residents filled the spaces where familiar faces had been. But the story of what happened had clearly spread. People watched him as he walked through, some with curiosity, others with respect, a few with something approaching awe. He kept his head down and moved toward the staff locker room to collect his things. Dr. Pacheco intercepted him before he reached the door. A word in my office, please. It wasn't a request. Vincent followed the chief of staff down a corridor to a small office filled with medical journals and family photographs. Dr. Pacheco gestured to a chair. Seat. Vincent sat. Dr. Pacheco settled behind his desk and pulled out a thick folder. I've spent the last hour reviewing your situation. The good news is that California has provisions for credentialing military medical personnel with combat experience. The program for military medic transition. It's designed exactly for people like you. Vincent felt his heart rate increase. People like me who walked away from medicine, People like you who received advanced medical training in the military and can demonstrate competency through experience. Dr. Pacheco opened the folder. You would need to complete a bridging program. Additional coursework in civilian emergency medicine. Clinical rotations supervised by licensed physicians. But your special forces training would count for significant credit. How long? Vincent asked. 6 to 12 months, depending on how quickly you complete the requirements. Dr. Pacheco looked up from the folder. And that's if you want to pursue full paramedic certification. If you're willing to work as a trauma technician or emergency medical specialist, the timeline is shorter. 3 to 4 months. Vincent tried to process the information. 3 months ago, he had been invisible. Now the chief of staff was mapping out a pathway back to medicine. It felt surreal. Impossible. Like a door opening that he thought had been welded shut. There's a complication. Dr. Pacheco's voice became more serious. Dr. Townsend has filed a formal complaint. He's alleging that you practiced medicine without a license, interfered with patient care, and created a hostile work environment. He wants you terminated and potentially reported to the medical board. Vincent's stomach dropped. I understand. I did interfere. I don't have a license. He's not wrong about that. He's also not right. Dr. Pacheco leaned back in his chair. California has Good Samaritan laws that protect people who provide emergency medical assistance. You identified a life-threatening condition and advocated for appropriate treatment. You didn't perform the procedure yourself. Dr. Kovacs did after confirming your assessment. But I'm not a bystander. I'm an employee. Doesn't that change things? It complicates things, Dr. Pacheco admitted, which is why I've asked the hospital's legal team to review the situation. But I'll tell you what I told Blake. If this becomes a formal investigation, we'll be examining everyone's conduct that day, including his failure to diagnose an obvious pneumothorax and his refusal to consider alternative assessments. Vincent looked down at his hands. I don't want Dr. Townsend to lose his job because of me. He's a good physician who had a bad day. He's an arrogant physician who let his ego override his clinical judgment. Dr. Pacheco's voice was sharp, and a patient died because of it. The fact that you saved that patient doesn't erase Blake's failure. It highlights it. The door opened and Dr. Kovacs entered carrying her own folder. She nodded to Dr. Pacheco and took the seat beside Vincent. I have the complete medical record for Jason Miller. The timeline of events. Documentation of the initial assessment and the misdiagnosis. She placed a folder on the desk. It's damning for Dr. Townsend. Multiple signs of tension pneumothorax were present on initial presentation. Any of them should have triggered further investigation. Dr. Pacheco opened the folder and scanned the contents. His expression remained neutral, but Vincent could see the tension in his jaw. How clear were the signs? Textbook. Dr. Kovacs' voice was clinical. Tracheal deviation to the right. Distended neck veins. Decreased chest wall movement on the left. Hypotension and tachycardia consistent with obstructive shock. The resident who did the initial assessment documented absent breath sounds on the left, but that note was apparently overlooked during the code. So the information was there. Dr. Pacheco looked up. Blake just didn't see it or didn't act on it. He was managing multiple critical patients simultaneously. Dr. Kovacs' tone softened slightly. I'm not excusing the miss, but I understand how it happened. Mass casualty events create cognitive overload. Mistakes become more likely. Vincent found his voice. Then maybe we shouldn't be destroying his career over a mistake. Maybe we should be looking at why one doctor was managing 3 critical patients at once. Why there wasn't enough backup. Why the system failed. Both physicians looked at him with surprise. Dr. Pacheco's expression shifted to something approaching respect. That's remarkably generous considering he tried to have you arrested. He was protecting his patients the only way he knew how. Vincent met the chief of staff's eyes. He thought I was a threat, someone unqualified interfering with medical care. From his perspective, he was doing the right thing. Dr. Kovacs leaned forward. You're defending the man who called you a janitor like it was an insult, who refused to listen when you were trying to save a patient. Why? Because I've made mistakes too. Vincent's voice was quiet. I've been so focused on my own failures that I let other people suffer. That's worse than missing one diagnosis in a crisis. At least Dr. Townsend was trying. I've spent 4 years not trying at all. The room fell silent. Dr. Pacheco and Dr. Kovacs exchanged glances. Finally, Dr. Pacheco spoke. Vincent, I'm going to be direct with you. This hospital needs people like you. Not because you're perfect, but because you care more about saving lives than protecting yourself. That's increasingly rare. Vincent shook his head. You don't know me. You don't know what I've done. What I've failed to do. I know what you did today. Dr. Pacheco's voice was firm. You risked everything to save a stranger. You stood up to authority when it would have been safer to stay silent. You showed more moral courage in 5 minutes than most people show in a lifetime. He paused. And I know you've been working in this hospital for 18 months watching patients die from preventable complications because you were too afraid to speak up. That's the weight you're carrying. That's what you need to forgive yourself for. The words hit like hammer blows. Vincent felt exposed, his guilt laid bare by someone who barely knew him but somehow saw straight through him. How many patients did I watch die? Dr. Kovacs' voice was gentle. That's not a productive question. The better question is, how many will you save going forward? Vincent thought about Jason Miller breathing in the ICU. Thought about Rebecca's tears and Emma and Sophia's gratitude. Thought about Sarah's voice in his memory, telling him not to stop. The path forward was terrifying, full of uncertainty and the possibility of failure. But the path backward, the path of hiding and watching and staying silent, was unbearable now that he had tasted what it felt like to save someone again. What I need to do, Vincent's voice was steady, to get credentialed, to come back to medicine properly. First, complete the application for the military medic transition program. Dr. Pacheco pulled papers from the folder and slid them across the desk. I'll write a letter of recommendation. So will Dr. Kovacs. Margaret Chun has already volunteered to do the same. Second, you'll need to document your military training and experience. Dr. Kovacs added, service records, training certificates, any performance evaluations you have from your time in Special Forces. Vincent hesitated. Most of my work was classified. I don't know how much documentation I can access. We'll work with the VA to get what we can. Dr. Pacheco made a note. Third, you'll start shadowing in the emergency department. Observational rotations where you watch and learn civilian protocols. No patient contact yet, but present for procedures and codes. When? Vincent asked. Tomorrow if you're willing. Dr. Pacheco looked at him seriously. I'm moving quickly on this because I believe you're an asset this hospital can't afford to waste. But I need to know you're committed, that you're not going to run again when things get difficult. Vincent thought about the courtyard conversation with Margaret, about her statement that he had already gone back to being Lifeline the moment he spoke up for Jason, about the impossibility of returning to invisibility after everything that had happened today. He could run, could disappear into another job in another city where nobody knew his story, could go back to hiding from his past and his guilt, or he could stay, could walk through the fear and uncertainty, could honor Sarah's memory by becoming what she had always believed he could be, a healer, a lifeline, someone who refused to let people die when he knew how to save them. I am committed. Vincent's voice didn't waver. I'll start tomorrow. Dr. Pacheco extended his hand across the desk. Welcome back to medicine, Mr. Chun. We're glad to have you. Vincent shook his hand, feeling the weight of the commitment settle onto his shoulders. It was heavy, terrifying, but for the first time in 4 years, it felt right, like he was finally walking toward something instead of running away. Dr. Kovacs stood. I should warn you that Rebecca Miller has been asking about you every hour. She wants to introduce you to Jason when he wakes up. Are you ready for that? No, Vincent admitted, but I'll do it anyway. That's the spirit. Dr. Kovacs smiled. Being a medic isn't about being ready. It's about showing up even when you're terrified. Sarah Martinez knew that. She chose you as her partner because she saw you had that quality. How do you know about Sarah? Vincent asked. Margaret told me. Dr. Kovacs' expression softened, and I looked her up. Read about the work you two did together, the lives you saved. She was an exceptional surgeon, and by all accounts, you were an exceptional medic. Her death wasn't your failure, Vincent. It was a tragedy. There's a difference. Vincent wanted to argue, but the words wouldn't come. Maybe someday he would believe that. Maybe someday the guilt would ease enough that he could separate what he could control from what he couldn't. Today wasn't that day, but it was a beginning. A first step back toward the person Sarah had believed he could be. Dr. Pacheco walked him to the door. Get some rest tonight. Tomorrow starts a new chapter. You'll shadow Dr. Kovacs on the day shift. 7 to 7. Wear scrubs from a dispenser in the locker room. And Vincent, his voice became serious. Thank you for today. For reminding us all what medicine is supposed to be about. Vincent didn't sleep that night. He lay in his small efficiency apartment staring at the ceiling, his mind replaying every moment from the emergency department. Jason's flatline. The rush of air when Dr. Kovacs decompressed his chest. Rebecca's embrace. The weight of Dr. Pacheco's expectations. By the time his alarm went off at 5 in the morning, he had been awake for hours. He showered and dressed in clothes he would change out of at the hospital. The journey to Metropolitan General felt different than it had for 18 months. He wasn't arriving to mop floors and empty trash. He was arriving to shadow physicians. To learn. To step back into the world he had abandoned. The terror was almost overwhelming. The locker room was empty when he arrived. He found the scrub dispenser and selected a set of navy blue surgical scrubs. The fabric felt foreign against his skin after so long in work uniforms. He caught sight of himself in the mirror and barely recognized the person looking back. The janitor was gone. Someone else stood in his place. Someone who looked like a medic again. Dr. Kovacs found him in the hallway outside the emergency department at exactly 7. She handed him a hospital identification badge with his photo and the designation medical observer. Clip this on. Don't lose it. Security gets twitchy about unidentified people in clinical areas. Vincent attached the badge to his scrub top. The simple act of wearing an ID that said something other than environmental services felt monumental. Dr. Kovacs studied his face. You look terrified. I'm terrified. Good. She started walking toward the emergency department entrance. Overconfident observers are dangerous. Terrified ones pay attention. She pushed through the doors into the organized chaos of the day shift. The department was already filling with patients. Chest pain, abdominal pain, a child with a fever, an elderly woman who had fallen. Normal emergency department volume. Dr. Kovacs moved through triage efficiently, reviewing charts and assigning priorities. Vincent followed her like a shadow, listening to her thought process as she explained her decision-making. This patient can wait. This one needs immediate labs. This one is probably nothing, but we'll rule out the scary stuff first. Her teaching style reminded him of Sarah. Clear, methodical, always explaining the why behind the what. They were examining a patient with possible appendicitis when Ramirez appeared in the doorway. Dr. Kovacs, ICU called. Jason Miller is waking up. His mother wants to know if Vincent is here. Vincent felt his chest tighten. Dr. Kovacs looked at him with raised eyebrows. Want to take a break from rounds? Vincent wanted to say no, wanted to hide in the safety of observing other patients. But he had made a promise to Rebecca, had told Dr. Pacheco he was committed to showing up even when terrified. He nodded. I'll go. Ramirez led him to the elevator and up to the 3rd floor ICU. The unit was quieter than the emergency department, but no less intense. Monitors beeped steadily. Nurses moved between rooms, checking lines and medications. The ICU attending physician, Dr. Sarah Okonkwo, according to her badge, met them at the nurse's station. You're Vincent Chun, the janitor who saved my patient. Dr. Okonkwo's voice held warmth and curiosity. Rebecca has been asking about you constantly. Jason's been in and out of consciousness for the past hour. He's confused but stable. Has he asked what happened? Vincent's voice was barely audible. He knows he was in an accident. Knows he coded in the emergency department. Doesn't know about you yet. Dr. Okonkwo gestured toward a room at the end of the unit. Rebecca wanted to tell him herself. With you there. Vincent followed her to the room. Through the window, he could see Jason in the bed, pale but breathing on his own. Rebecca sat beside him, holding his hand. Emma and Sophia stood near the foot of the bed. All three looked exhausted, but their faces held relief that hadn't been there yesterday. Rebecca looked up as Dr. Okonkwo opened the door. She stood immediately and crossed to Vincent. Her embrace was gentler than yesterday, but no less heartfelt. "You came. Thank you for coming. How is he?" Vincent asked, awake, asking questions. Rebecca's eyes were red from crying, but she was smiling. "The doctors say he's going to recover fully. No brain damage. No permanent injuries." She pulled back and looked at him intently. "He doesn't know about you. I wanted you here when I told him." Vincent's throat felt tight. He looked past Rebecca to the teenager in the bed. Jason's eyes were open, watching the interaction with confusion. Vincent forced himself to walk closer. Rebecca returned to her son's side and took his hand again. "Sweetie, there's someone I need you to meet." Rebecca's voice was gentle. "This is Vincent Shun. He works at the hospital." Jason's voice was hoarse from intubation. "The janitor? Mom mentioned you. Said you helped." "He did more than help." Rebecca's voice broke slightly. "The doctors said you had died. Your heart had stopped. They called the code. And Vincent knew you were still alive. Knew what was wrong. He fought to make them listen." Jason's eyes moved from his mother to Vincent, trying to understand. "You brought me back?" Vincent shook his head. "Dr. Kovacs brought you back. I just saw something the other doctors missed. A collapsed lung that was stopping your heart. Once they fixed it, your heart started again. But they weren't going to fix it." Emma spoke from the foot of the bed. "They'd stopped trying. Mom said you wouldn't let them give up." Vincent didn't know how to respond. The teenager was looking at him with an expression Vincent recognized from Afghanistan. The look soldiers gave medics after surviving wounds that should have killed them. Gratitude, mixed with disbelief, mixed with the profound recognition of how close death had come. Jason's hand lifted slightly from the bed, reaching toward Vincent. Vincent stepped closer and took it carefully, mindful of the 4 lines. The teenager's grip was weak but present. "Thank you." Jason's voice cracked. "I don't really understand what happened, but thank you for not letting me die." The words hit Vincent harder than he expected. He thought about all the soldiers he had saved, all the thank yous he had heard in field hospitals and aid stations. But this felt different. This was civilian. This was a 16-year-old kid who should have been in school, not fighting for his life in an ICU. This was everything Sarah had talked about when she described why she volunteered for combat zones. Because everyone deserves a chance to live. Everyone deserves someone willing to fight for them. "You're welcome." Vincent's voice was rough. "You're going to be okay. You're young and strong. You'll recover from this." "Will you visit again?" Jason asked. "While I'm here, I'd like to hear about what happened. When I'm more awake and can actually understand." Vincent looked at Rebecca. She nodded encouragingly. "I can do that. When you're feeling better." They talked for a few more minutes. Jason drifted in and out, the medications making sustained conversation difficult. Rebecca walked Vincent to the door when he finally said he should get back to the emergency department. In the hallway, she hugged him again. "You gave me my son back." Her voice was fierce. "I don't have words for what that means. What you mean to our family now. I'm just glad he's alive." Vincent meant it. Seeing Jason breathing, talking, squeezing his hand made everything worthwhile. The confrontation with Dr. Townsend, the exposure, the fear, all of it was worth this moment. Rebecca pulled back and looked at him seriously. "The nurses told me about you, about your background, about how you've been working as a janitor for over a year." She paused. "I don't know what happened to make you walk away from medicine, but I'm grateful you found your way back, even if it was just for one day. Even if it was just for Jason." Vincent felt tears forming. He blinked them back. "Your son reminded me of something I had forgotten. That saving lives matters more than protecting myself from pain." Rebecca's hand found his arm. "Whatever pain you're carrying, I hope you find healing. You deserve it, just like Jason deserves the life you gave back to him." Vincent returned to the emergency department to find Dr. Kovacs treating a patient with chest pain. She gestured for him to observe as she performed an EKG. While they worked, she asked about Jason. Vincent told her about the visit, about the teenager's gratitude, about Rebecca's words. Dr. Kovacs finished placing the electrodes and started the machine. "How did it feel? Seeing the patient you saved?" "Terrifying," Vincent admitted. but also right. Like I was finally doing what I was supposed to be doing. The EKG printed results showing a normal rhythm. Dr. Kovacs reviewed it quickly. Good. Not a heart attack. She turned to Vincent. That feeling of rightness? Hold on to it. You're going to need it when things get hard. When you make mistakes. When you can't save someone despite your best efforts. What if I can't handle it? Vincent's fear leaked through. What if I freeze again? What if someone dies because I'm not good enough? Then you'll grieve and learn and keep trying. Dr. Kovacs' voice was matter of fact. That's all any of us can do. We're not gods. We're just people with training trying our best. Sometimes our best isn't enough, but we show up anyway. The rest of the shift passed in a blur of patients and procedures. Vincent observed intubations and chest tube placements and central line insertions. He watched Dr. Kovacs manage a stroke activation and a septic patient and a child with a broken arm. Every case reinforced how much he had to relearn. Civilian medicine had different protocols than combat medicine, different equipment, different priorities, but the fundamental skill of assessment and intervention remained the same. Near the end of the shift, Margaret found them. She was carrying a folder. Vincent, I thought you might want to see this. She handed him the folder. Inside were printouts of news articles. Local news outlets had picked up the story. Janitor saves teen's life. Hospital worker's hidden military background. Former combat medic returns to medicine. Vincent's photo was in several of the articles. Someone had found an old military photograph from his time in Afghanistan. Young Vincent in combat gear, serious expression, eyes that hadn't yet seen everything they would eventually witness. The contrast with current Vincent was stark. The hospital's getting calls. Margaret said gently, other veterans asking about you, about the credentialing program, about how they can get back into medicine too. Her voice held quiet pride. You become a symbol, Vincent, for everyone who thought they couldn't come back from their failures. Vincent closed the folder, overwhelmed. I'm not a symbol. I'm just someone who got lucky once. Margaret shook her head. You're someone who chose courage over comfort, who chose to speak truth to power, who remembered what it means to fight for someone's life. She touched his shoulder. That's not luck. That's character. Dr. Kovacs finished her charting and turned to Vincent. First day done. How do you feel? Exhausted. Overwhelmed. Vincent paused. Alive. For the first time in 4 years, I feel alive. Then you're exactly where you need to be. Dr. Kovacs smiled. See you tomorrow at 7. Same time, same terrified expression. Vincent left the hospital as the sun was setting. He walked past the spot where he used to stand in his janitor uniform, invisible to everyone rushing past. That person was gone now, replaced by someone he was still learning to recognize. Someone who wore scrubs instead of work clothes. Someone who saved lives instead of cleaning up after them. Someone who was finally, impossibly, keeping the promise he had made to Sarah Martinez 4 years ago. Still here, Sarah. Still trying. And this time, I'm not stopping. 3 weeks passed in a blur of learning and observation. Vincent shadowed different physicians, each shift, absorbing civilian protocols and modern emergency medicine techniques. He studied at night, reviewing pharmacology and diagnostic algorithms that had evolved since his separation from service. The military medic transition program paperwork moved through bureaucratic channels with surprising speed, aided by Dr. Pacheco's advocacy and letters of recommendation from multiple physicians. Jason Miller was discharged from the hospital on day 12. Vincent visited him the day before he went home. The teenager was walking with assistants. His color returned, his smile genuine. They talked for an hour about nothing important. Jason's plans to return to school. His dreams of maybe becoming a paramedic someday, because of what happened. Vincent listened and encouraged and tried not to see himself in the teenager's determination to make meaning from trauma. On Vincent's 21st day as a medical observer, Dr. Pacheco called him into his office. Vincent arrived to find not just the chief of staff, but also Robert Chun and a woman he didn't recognize. She was in her 50s with kind eyes and a Veterans Affairs identification badge. Vincent, this is Dr. Patricia Nguyen from the VA Medical Center. Dr. Pacheco gestured to the empty chair. She has news about your credentialing application. Dr. Nguyen opened a folder on her lap. Mr. Chun, I've reviewed your military service record, your training documentation, letters of recommendation from your current supervisors and from colleagues who served with you. She looked up at him. Your application for accelerated credentialing has been approved. Vincent felt his heart skip. Approved? You'll still need to complete clinical rotations and pass certification examinations. Dr. Nguyen continued. But your combat experience has been validated and will count toward your supervised clinical hours. You can begin working as an emergency medical technician under supervision immediately. Full paramedic certification should follow within 6 months if you complete the required coursework. Robert Chin leaned forward. The hospital is prepared to sponsor your training. We'll cover the cost of courses and examinations. In exchange, you'll commit to working here for a minimum of 2 years after certification. Vincent tried to process the information. A month ago, he had been mopping floors. Now, they were offering to pay for his training and guarantee him a position. It felt impossible. Too good. Like something that would be taken away the moment he reached for it. There's something else. Dr. Townsend has withdrawn his complaint against you. He's also resigned from his position as chief of emergency medicine. Vincent's stomach dropped. No, that wasn't supposed to happen. I didn't want him punished. It wasn't your choice. Dr. Pacheco's voice was firm. The medical review board examined the Jason Miller case along with several other incidents where Dr. Townsend's judgment was questionable. They concluded that his performance had deteriorated over the past year. Burnout, cognitive fatigue. He needed to step back before something worse happened. Is he okay? Vincent asked. He's taking a medical leave, getting help for stress and exhaustion. Robert Chin's voice was gentle. This wasn't punishment, Vincent. This was intervention. Blake is a talented physician who pushed himself too hard for too long. The review board gave him a path back, but he needs time to recover first. Vincent thought about Dr. Townsend's face during the confrontation. The exhaustion beneath the arrogance. The fear beneath the anger. A man trying to hold everything together while falling apart. Vincent understood that feeling intimately. I'd like to write him a letter. Vincent looked at Dr. Pacheco. If that's allowed. To apologize for how things happened. To let him know I don't hold any anger toward him. Dr. Pacheco nodded slowly. I'll make sure he receives it. But Vincent, you need to understand something. You didn't destroy Blake's career. You may have saved it, and possibly saved future patients from errors that could have been fatal. The meeting continued with details about Vincent's training schedule and clinical rotations. Dr. Nguyen explained the curriculum requirements. Robert Chun outlined the employment contract. Vincent signed papers and listened to instructions and tried to absorb that his life was changing in ways he had stopped believing were possible. As the meeting ended, Dr. Pacheco stopped Vincent at the door. One more thing. Margaret Chun has been organizing something. A small ceremony next week recognizing hospital staff who went above and beyond. She's insisting you be included. Vincent felt panic rise. I don't need recognition. I just did what anyone would do. That's exactly why you deserve recognition. Dr. Pacheco smiled. Because you think saving lives is ordinary. That humility is what makes you extraordinary. The ceremony took place on a Wednesday afternoon in the hospital's main auditorium. Vincent tried to skip it, but Margaret had anticipated his resistance and enlisted Ramirez to physically escort him to the event. He sat in the back row wearing clean scrubs and wishing he could disappear. The hospital administrator spoke about excellence in patient care. Several nurses received awards for long service. A physician was recognized for research contributions. Then Margaret took the podium and Vincent's chest tightened. Our final recognition today goes to someone who reminds us why we chose healthcare as our calling. Margaret's voice carried across the auditorium. 3 weeks ago, Vincent Chun was working as a janitor in our emergency department. But Vincent carried something with him that wasn't visible in his job title. Years of experience as a special forces medic. Knowledge earned in the hardest conditions imaginable. And a commitment to saving lives that he had buried beneath guilt and grief. Vincent wanted to leave, but Ramirez had positioned herself between him and the exit. Margaret continued. When a teenage patient coded and was declared deceased, Vincent saw what our physicians had missed. Attention pneumothorax, a treatable condition. He spoke up despite knowing it could cost him his job, despite facing ridicule and anger, despite every reason to stay silent. And because of his courage, Jason Miller is alive today. Margaret gestured to the audience. Vincent wasn't looking for recognition. He was looking for redemption. He was trying to keep a promise made to a fallen friend. But what he found was something more important. He found his way back to being a healer. And in doing so, he's opened a door for other combat medics struggling to transition back to civilian medicine. The auditorium erupted in applause. Vincent felt his face burning. Margaret was gesturing for him to come to the podium. He shook his head, but the applause grew louder. Ramirez nudged him. Go. You earned this. Vincent stood on shaking legs and walked to the front of the auditorium. The applause continued. He saw familiar faces in the audience. Dr. Kovacs, Dr. Okonkwo from the ICU, nurses he had worked with. And in the third row, Rebecca Miller with Jason beside her. The teenager was standing and clapping with his mother and sisters. All four of them were crying. Margaret handed Vincent a framed certificate. Hospital Hero Award for exceptional courage and life-saving action. He stared at it, unable to speak. Margaret leaned close and whispered, Say something. They need to hear from you. Vincent approached the microphone. His hands gripped the podium to keep them from shaking. The applause finally faded. Hundreds of faces watched him expectantly. He opened his mouth and no words came. He tried again. I'm not a hero. His voice cracked. I'm someone who ran away from medicine because I was afraid. Because I failed someone important and convinced myself I didn't deserve a second chance. He paused, gathering courage. For 4 years, I watched patients in this hospital and stayed silent. Too afraid to speak up. Too broken to try. That's not heroic. That's cowardice. The auditorium was completely quiet now. Vincent looked at Jason. Until I saw Jason dying from something I knew how to fix. And in that moment, I had to choose. Keep hiding, or remember what I was trained to be. What someone I loved taught me to be. He gripped the certificate tighter. Dr. Sarah Martinez was a trauma surgeon who volunteered for the most dangerous places because she believed everyone deserves someone willing to fight for their life. She died in Afghanistan doing exactly that. And before she died, she made me promise not to stop saving people. I broke that promise for 4 years. His voice broke, but Jason gave me a chance to keep it again. So this award, if it belongs to anyone, belongs to Sarah, for believing I was worth teaching, and to Jason for reminding me why I became a medic in the first place. Vincent stepped back from a microphone. The applause started again, but it sounded different now. Softer, more understanding. Rebecca was openly crying. Jason was wiping his eyes. Margaret embraced Vincent as he left the podium, her own face wet with tears. You honored her, Margaret whispered. Sarah would be so proud of you. The ceremony ended, and people approached Vincent to congratulate him, to shake his hand, to thank him for his service. He accepted it all with as much grace as he could manage, feeling exposed and vulnerable and strangely lighter than he had in years. Saying Sarah's name aloud, acknowledging his failure and his fear. It felt like lancing a wound that had been infected for too long. Painful but necessary. Jason and his family waited until the crowd cleared. The teenager approached Vincent with the same careful respect he had shown in the ICU. My mom told me about your friend. About Dr. Martinez. I'm sorry she died. Thank you. Vincent's voice was rough. She would have liked you. Well, I've fought for you the same way I did. Rebecca stepped forward. We wanted you to know that we've set up a scholarship in your honor for students interested in emergency medicine. We can't repay what you did, but we can help others follow the path you showed us. Vincent felt tears forming again. You don't need to do that. We want to. Rebecca's voice was firm. You gave us our son back. This is how we make sure your courage continues to matter. That evening, Vincent sat in his apartment with the certificate on the table beside him. He pulled out his phone and opened the photo of Sarah. She was smiling in her blood-stained scrubs, exhausted and triumphant after saving 6 patients in one shift. He touched the screen gently. I kept the promise, Sarah. Finally. It took me 4 years and a dying kid and more courage than I knew I had left. but I kept it. He paused, his throat tight. The VA approved my credentialing. I start working as an EMT next week. Back in medicine. Back to saving lives. Back to being Lifeline. He looked at the certificate again. Hospital hero. The words felt too large for him. But maybe that was the point. Maybe heroism wasn't about feeling worthy. Maybe it was about showing up despite the fear, despite the guilt, despite every reason to stay hidden and safe. Vincent set the phone down and opened his laptop. He had a letter to write to Dr. Townsend, an apology and an understanding. One broken healer reaching out to another, trying to build bridges instead of burning them. The healing had begun. For Jason, for the other veterans who were calling about the credentialing program, and finally, impossibly, for Vincent himself. 6 months later, Vincent stood in the emergency department wearing a different uniform. EMT emblazoned across the back of his navy blue shirt. A radio clipped to his belt, a trauma bag over his shoulder. He was responding to calls now instead of watching from the sidelines, living the promise instead of running from it. The certification exam had been grueling, but Vincent passed on his first attempt. His combat experience translated well to civilian emergency medicine once he learned the different protocols and terminology. Dr. Kovacs supervised his clinical rotations and declared him ready for independent practice ahead of schedule. The hospital hired him immediately as a senior emergency medical technician with plans to sponsor his paramedic training starting in the fall. Vincent's radio crackled. All units, motor vehicle collision on Route 17. Multiple patients. All available EMTs respond. He grabbed his bag and headed for the ambulance bay, where Ramirez was already starting the engine. She had cross-trained as an EMT and frequently partnered with him on calls. They worked well together, their communication efficient, and their mutual respect deep. The accident scene was controlled chaos when they arrived. 3 vehicles, 5 patients, 2 already being loaded into ambulances. Vincent moved to the remaining patient, a woman in her 30s trapped in the driver's seat of a sedan. She was conscious, but her breathing was labored. Vincent's training kicked in automatically. "Ma'am, my name is Vincent. I'm an EMT. Can you tell me where you're hurt?" "Chest. Hurts to breathe." The woman's voice was tight with pain. Vincent scanned her quickly. No obvious external injuries, but the steering wheel was deformed, suggesting significant impact. He reached through the window and palpated her chest gently. She winced. Possible rib fractures. Possible pneumothorax. He had seen this presentation before. Vincent pulled out his stethoscope and listened to her lung sounds. Decreased on the right side. His heart rate increased slightly, but his hand stayed steady. He knew exactly what this was. Knew exactly what needed to happen. And this time, he had the authority and credentials to act. "Ramirez, we need to expedite extrication. Possible tension pneumothorax developing. Alert the hospital, we're bringing in a critical respiratory case." Vincent's voice was calm and clear. The voice of someone who knew what he was doing. The voice of Lifeline. The firefighters worked quickly to remove the car door. Vincent stabilized the woman's neck and monitored her breathing. When they finally freed her and transferred her to the stretcher, her oxygen saturation was dropping. Vincent started high-flow oxygen and established 4 access in the ambulance. Ramirez drove with lights and sirens while Vincent stayed with the patient, watching for signs of deterioration. They made it to Metropolitan General in 8 minutes. Dr. Kovacs met them at the door, already gowned and ready. Vincent gave his report with practiced efficiency. 32-year-old female, restrained driver, significant chest impact, decreased breath sounds right side, falling oxygen saturation, concern for developing tension pneumothorax. Dr. Kovacs nodded and took over care seamlessly. "Good catch, Vincent. We'll take it from here." The patient was wheeled into Trauma Bay 3, the same room where Jason Miller had died and been brought back. Vincent watched through the glass as the team worked. This time he wasn't a janitor watching helplessly. He was part of the team, part of the solution. The woman survived. Dr. Kovacs decompressed a developing pneumothorax, and the patient stabilized quickly. Vincent filled out his paperwork and restocked his trauma bag, the routine tasks grounding him. Ramirez found him in the supply room. Nice work out there. She handed him a bottle of water. You called it perfectly. Just pattern recognition. Vincent accepted the water gratefully. Seen it enough times to know what it looks like. That's what makes you good at this. Ramirez leaned against the counter. You've seen things most of us only read about in textbooks. Your experience saves lives. Vincent thought about that. 6 months ago, he would have rejected the praise, would have deflected and minimized his contribution. But he was learning, slowly, to accept that his past had value. That the pain and trauma he carried also came with knowledge and skill that mattered. Their shift ended at 7. Vincent changed out of his uniform and walked to the hospital parking lot. His phone buzzed with a text from Margaret. Coffee tomorrow morning? Have someone I want you to meet. He replied with a thumbs up and put the phone away. Vincent drove to the cemetery on the edge of town. He made this trip every week now, rain or shine. Sarah's grave was in a quiet section beneath an oak tree. He knelt beside the headstone and traced her name carved in granite. Hey, Sarah. Vincent's voice was soft. Had a good save today. Woman with a pneumothorax developing. Caught it early because you taught me what to look for. She's going to be fine. He paused, gathering his thoughts. Jason Miller came by the hospital last week. He's thinking about becoming a paramedic, taking EMT classes in the fall. Says I inspired him. Can you believe that? The wind moved through the oak leaves above him. Vincent pulled out a photograph from his pocket. It had been taken last month at the hospital. Vincent in his EMT uniform standing with Dr. Kovacs, Margaret, Ramirez, and Dr. Pacheco. All of them smiling. He propped it against the headstone. This is my team now. The people who helped me find my way back. Margaret reminds me of you sometimes. Same fierce determination. Same refusal to let people give up on themselves. He smiled slightly. You would have liked her. Vincent sat in the grass, comfortable with the silence. 6 months ago, he couldn't come here without breaking down. The guilt had been too overwhelming. The sense of failure too complete. But Dr. Kovacs had been right. Healing didn't mean forgetting or stopping the pain. It meant learning to carry the weight without letting it crush him. I got a letter from Dr. Townsend last week. Vincent continued. He's doing better. Taking time off helped. He thanked me for the letter I sent. Said it meant more than I knew. He might come back to medicine eventually. Different role. Less pressure. We're meeting for coffee next month. A young couple walked past on the path, giving Vincent a respectful nod. He nodded back and returned his attention to Sarah's grave. The VA is sending me other veterans now. Combat medics who want to get back into medicine but don't know how. I'm helping them with applications and credentialing, sharing my story so they know it's possible to come back. He pulled out his phone and showed the headstone and news article. Local hospital launches Veteran Medical Transition Program. Vincent's photo was prominent, along with quotes about second chances and honoring military service. The program had enrolled 8 veterans so far, all of them working their way back to healthcare careers. This is your legacy too, Sarah. All the lives I save now, all the veterans I help. It all comes back to what you taught me, that everyone deserves someone willing to fight for them. That saving lives matters more than protecting ourselves from pain. Vincent's voice thickened. I'm fighting again. Finally, like you always knew I could. The sun was setting, painting the sky in shades of orange and purple. Vincent stood and brushed grass from his pants. He touched the headstone one more time. Still here, Sarah. Still saving them. Still being lifeline. And I'm not stopping. Not ever again. He returned to his car and drove to his new apartment. Not the efficiency studio he had lived in as a janitor, but a real one-bedroom with space and light and furniture that wasn't secondhand. The walls held framed photographs. His military unit. Sarah in her surgical scrubs. Jason Miller's family at the hospital ceremony. Dr. Kovacs teaching him a procedure. Margaret and Ramirez at the EMT graduation. Vincent made dinner and reviewed study materials for his upcoming paramedic coursework. His phone buzzed with a message from Rebecca Miller. Jason wanted to know if you're free Saturday. He has questions about EMT school. Vincent typed back that he was available and would be happy to talk. Another message came through. This one from an unknown number. Mr. Chun, my name is Thomas Reed. I'm a former Army medic. I saw your story in the news. I've been struggling since I got out. Working construction, but I miss medicine. Is it really possible to come back? Vincent stared at the message for a long moment. Then he typed a response. Yes, it's possible. It's hard and it takes courage, but it's possible. I can help you with the process if you're ready. The reply came quickly. I'm ready. I've been ready for 3 years. I just didn't know where to start. Vincent smiled and sent him the VA program information along with his phone number. Call me tomorrow. We'll figure this out together. More messages came over the next hour. Veterans reaching out, asking questions, looking for hope. Vincent answered each one patiently, remembering what it felt like to believe there was no way back. Remembering the darkness of those 4 years. Remembering the moment Jason Miller's heart restarted and the crack of light that had broken through his grief. Late that night, Vincent stood at his window looking at the city lights. Somewhere out there, patients needed help. Veterans needed guidance. Lives needed saving. And for the first time in 6 months, Vincent felt ready for all of it. Not perfect, not without fear, but ready. His reflection in the window showed someone he was finally learning to recognize. Not the broken medic who had run from medicine. Not the invisible janitor hiding from his past. Someone new. Someone healing. Someone who understood that redemption wasn't about erasing mistakes, but about choosing to keep trying despite them. Vincent picked up his phone one more time and opened the photo of Sarah. Thank you for not giving up on me, even when I gave up on myself. Thank you for teaching me that being a healer isn't about being perfect. It's about being willing to fight. He touched the screen gently. I promise I'll keep fighting. For every patient. For every veteran who needs a way back. For everyone who deserves a second chance. He set the phone down and turned off the light. Tomorrow would bring new emergencies, new challenges, new opportunities to save lives and honor the promise he had made. Vincent was ready. Finally, impossibly, wonderfully ready. Still here, still trying, still being lifeline. And this time, he wasn't stopping for anything. If this story moved you, if it reminded you that second chances are possible, that heroes can be found in the most unexpected places, please subscribe to our channel. Share in the comments who is the quiet hero in your life that deserves recognition. Sometimes the greatest warriors aren't the ones still in uniform, but the ones who find their way back despite everything trying to stop them. Thank you for watching.